Hello, peeps. How is it going? Welcome to our podcast, You Don't Look Disabled, where we talk about disability through an intersectional lenses and nothing. Today we're going to talk about shenanigans. Rimbi, present shenanigans.
Okay, here's shenanigans. Where's the shenanigans? I don't know.
Dude, the theme of today's podcast. Fuck's sake.
I'm kidding. I was just teasing Todd at this point. Today's shenanigan. It's really shenanigan, really. It's about medical invalidation. And more specifically to invisible disabled peeps. What I mean, invisible disability, by the way, is a kind of a broad bunch of disabilities. I'm talking about mental illnesses as well, cardiac illnesses, and also our neurodivergences. And we also suffer from a lot of medical validation because
you don't fucking look disabled, which is basically the title of the entire podcast, not gonna lie. About time we talk about this, you don't look disabled. Let's talk about invisible disabilities, guys.
Yeah, we had to reach to that point, that we're going to talk about the title itself. And I will not actually connect the dots. Thank you. I will not remember that. Yeah, our title is emblematic of the amount of invalidation that we suffer.
Yeah. And for those of you that don't know, both of us are autistic and ADHD. So both of us have invisible disabilities. In our case, they are not mental illnesses as much as they are neurodivergencies. Thank you so much for the follow, Tatsinart. Thank you. Very much appreciated.
For me, I don't know if I can have a mental illness, but that
okay gets in. Yeah, but okay, in terms of things that we are sure of, and yes, you might be also mentally ill. And another thing in your case is that you are working in the actual, health field.
In hell.
In hell. God.
I'm working hell. I have to be realistic. Okay. Yes, I'm working on it. What do you want to know?
I want to know what is your perception on both sides of this thing, because I guess the most obvious one is that we, as people that don't look disabled, are very often overlooked by the medical professionals. But there's another side to this coin, which is people who are disabled working in these fields, how they actually get treated by the health system itself. So there are two different dimensions of this, and I think they are both equally interesting. Today, this is your podcast. You remember when we talked about education and I was a teacher and I stole the entire podcast for myself?
Okay, I can steal it. I can steal it.
You can.
I'll steal this podcast. I can steal this podcast. A brand new System of a Down album. Check it out. God damn it. He has the image of a thumbnail of our thumbnail. That would be pretty okay. I'm just going a little chaotic here. So for those that are new, I am a training healthcare professional. I'm not even a professional, but that's besides the point. Okay, so I work in healthcare, and yes, I have a more both several perspectives on how medical validation happens, but I had to be a little narrow it down so I could really steal this podcast, and I don't having that much energy to actually
I won't
talk.
Let you.
Yeah, I don't have that much energy, to be honest, compared to last week. But okay, let's start. I'm going to start by saying that self-diagnosis is valid. I had to say this. I had to say this. It's stronger than me. And this is actually, because people that get diagnosed late, with ADHD, autism, whatever, or any type of medical like neurodivergence, or even that is typically diagnosed in childhood, what happens is at first there's like a difficulty to get the medical diagnosis, and for many, like, medical diagnosis means that they truly have that condition, you know. But there's a thing called like at least I call it individual validation, which is a thing. People, there's a lot of peeps that especially in the medical field, that think that self-diagnosis is not valid because people self-diagnose themselves because, and they consider to have that
Oh,
condition, but they don't
Hindi.
have the so-called medical validation. Well,
Our community doesn't consider self-diagnosis valid a lot of times, and you are expecting the medical professionals to do that? Wow, you really want to live in an utopia.
I just thought that was, yeah, even inside the community, as we talked previous episodes, yes, doesn't validate self-diagnosis, because we are very pro at gatekeeping stuff, and we should
Yay.
supposed to be accessible, and we should be accessible, but we are just prone at not being accessible.
Oh, you used the wrong term. Now you're cancelled, and we're gonna keep you from the community because, yay, that's.
because he was crippled. Oh my goodness.
God dang it.
It's a whole conversation,
Yeah,
actually.
yeah, it was a whole conversation. And you know, like, it's already bad as it is when it's, your own community, but it's just as bad when it's medical professionals where you go look for help for a lot of stuff, and you really need guidance, and you really should be able to trust these professionals. And a lot of times it's just like, nah, not today, bro, not gonna happen.
Yeah, but I'm uh okay, where was I?
Sorry, I did the ADHD thing where I just interrupted you again. Yay, sorry.
And I have the ADHD thing called mind fog all the time, and at this point,
Fucking mood.
it's not funny. You're talking about the community about this. Yeah, but I already talked that a little last episode, and I don't want to touch that again.
Yes,
But I have.
no. I was just.
Okay. I'll just cite a little slightly, because actually I have a conversation, a very interesting conversation, where actually I exploded on a chat, and I said, like, you know what, guys, I think we just I think we're messing up the concepts, you know.
In what sense?
What? Okay. I hope this doesn't get, because I need to check some what actually I said, because I don't remember. I hope. I hope it's not making interference. Actually.
It's gonna make interference when you start opening tabs on your computer, because your computer is absolute shit. There's no simple, there's no nice way of saying it. Your computer is very bad.
No, I'm actually opening a tab on my telephone. So.
What are you trying to find?
What I said, because I don't remember.
Meanwhile, I would like to state that I have so much medical trauma. So, like, last week there was no episode because I was basically dying of sleepiness. I've been sleeping a lot, and basically doctors are not being able to find why I am sleepy all the time or why I have pain in my body all the time. But the fact is, I have been sleeping a ridiculous amount of hours per day, and this week, except yesterday, I've been sleeping an average of 11 hours per day, which is insane, because that means that the rest of the time I just spend working. And, I would like the doctors to, tell me something or do something, and it's very complicated. I have a lot of issues trusting doctors due to past experiences, and I have been dismissed over and over and over and over in what concerns my even diagnosed questions. I have a very bad episode that happened like not even a year ago, related to this, in which I had doctors and nurses asking me in a pretty rude way if my ADHD medication even did anything when it wasn't even related to the topic at hand, or questioning if my autism was that much of a problem in kind of a judgmental way, when it was, we were just talking about, me having a surgery, and it's like, I mentioned that, and the doctor just started being kind of stupid about it. And my experience with the medical professionals is just being dismissed, being misjudged, and just, I want something, I need help with something, and they just send me home with a bunch of pills. Last time it was
Yeah.
opioids, and they just send me home. And that's basically my experience with medical professionals overall. Not all of them, but yeah, sorry, go on.
So I wanted to comment on that. There's a lot to unpack here. Okay, I will start by medical trauma. Okay, so we had to establish here that the population of people with invisible disabilities has a big prevalence to have medical trauma because, well, precisely because of invalidation by the physicians and other healthcare professionals. And there's a lot of factors that, because invisible disabilities are not taken seriously, because they don't have actual symptoms, at least physical symptoms that they can measure with actual medical exams. Not just questioning the
Actual
patient.
medical exams. God damn.
They're fake ones, not like questioning the patient is not an actual exam. It's I'm shit posting here, but really,
Are you though?
no, I'm not that much, because here's the thing. In the actual in the current model in the current system that healthcare is in, there's an established medical authority, that you shouldn't question. At least that's how it works. I'm struggling a little bit to speak today. So the physician actually, they observe your symptoms. They ask you about your symptoms, and that's pretty much it. And they make their clinical judgment according to what you describe. There's a lot of issues going on here. Like there's they because you're still very dependent on the medical judgment, which is biased, which can be biased. They can make a different interpretation of what you describe, or you can actually have troubles to describe your symptoms because autistics can have a hard time to describe their pain, to describe their symptoms in a conventional way that medical physicians can understand. Because, well, so there's a lot of factors to get invalidated, and also gender, amazing, I know, and race, those things are also work in very insidious ways in the clinical judgment, because even there's a perception that Black people feel less pain than white people.
Yeah.
And medical textbooks, actually, they teach you about this default body, which is the cis white man body. So you can notice how it is very easy to make improper clinical judgments because they learned on default bodies, on default definitions. Because, all bodies are different, and this is the I already run away from a medical trauma. Oh my goodness, I'm avoiding this thing. I'm going to come back to medical trauma again.
Why are you running away from your topic, Ribi? How dare you?
From medical trauma. I'm doing avoidant coping mechanism right
but
now.
you chose the topic. How dare you?
I know. I chose the topic. I'm cruel. Like they have the trauma. No, actually, I also have medical trauma. in
Oh,
a
really?
in a different level, and it was kind of not very mild, because I not very mild, because
Ah,
it was, I have trauma with the family doctor, that she was very validating and very condescending when I was a kid, and that actually made me avoid um not hospitals, it's primary care facilities, I think. Yeah, those are the names. uh for a while, for at least 4 years, for 4 years, uh, or five, I don't know. And it was concerning, because I remember my classmates were asking, "Why don't you go to the primary care facility?" And I couldn't explain to them that it was because of trauma. At the time, I was not rationalizing that it was because of trauma. What I mean by this is, actually, people can avoid hospitals and primary care facilities because of trauma, and that can make us, more prone to negligence of our health.
yeah, I
And it
literally only
probably
go to the hospital or any healthcare facility when I'm basically I feel like there's no more avoiding it. I already excluded all other options and I really need help. And so I literally go to the doctor. It's my last option, and then you get there and the way, because you look healthy, like I look like, I'm 26, I'm white, I have good mobility overall even with all my pain, but
good
hello.
mobility. That's funny.
It's like, it's a thing. I can move fine because I'm masking. I am trying to, not look weird. So
He can move
my
fine. Believe him, really. They can move fine.
I, I
Sorry.
I can. That's the thing. I can. I just will
Yeah,
suffer pain from it later on, but I can.
it's
Uh,
fine.
but that's what I need to do in order to even perform my job. So uh, I look absolutely fine. Everyone looks at me, um, and and what they see is supposedly a healthy young quote unquote woman. Uh, and even though I now look a little bit more queer than what I used to, and honestly, I feel like that's starting to also be a problem with the way medical
Mm.
professionals look at me. From my experience with the last exams, they look at me very weird. I give my ID card, and people start looking at me like, okay.
But
It's
you just cut
very
your
weird. I
hair.
literally cut my
I,
hair. I mean, I'm binding, and my way of dressing is very masculine, but apparently that's enough for
I mean,
medical
you could
professionals
pass.
to.
I mean, you could just pass as a 20-year-old Karen. What is the problem?
I can.
Decision.
That's it, but the thing is, I can. I do have a very androgynous way of looking these days, mostly. And I do feel like I've been getting
We switched,
more
guys. We
weird
switched.
looks from medical professions, and even comments I don't really understand. Like it got verbal. Uh, so but regardless, I do look healthy, and that's the most important thing at first. Then I am a fab. No matter how much I try to insist, I if I try to insist too much, I'll probably be like, "Oh, it's just drama and emotionality or whatever going on, probably on their period or something." And then I look queer, which is very uncomfortable, and it's all the factors that will just make the doctors just absolutely not care, because
Hmm.
of course everything's fine,
For me,
and it's very scary.
uh, yeah, I can see. Well, but okay, because what actually I am afraid of going to the, because now you just told me, yeah, here are those layers that actually can make the clinical judgment a little biased, you know,
Mm-hmm.
because healthcare professionals can be extremely, I say this for real, because they can be extremely judgmental. Oh goodness, it was hard to get this word. Because, well, they just objectify the patient.
Yeah. Oh, another thing that I forgot, but we both forgot it right at the beginning of this podcast. We started by focusing on mental conditions as invisible disabilities, but I guess that comes a little bit from our common background, which is kind of ironic in my case, considering that I literally suffer from pain every single day of my life. But at the same time, because I don't have a diagnosis, it's kind of hard to think of myself as a physically disabled person, which, when I think about it, I am. It's obvious,
It
but
was actually it was actually kind of the partially the motive to talk about this. It was actually a
yes,
suspicion of a condition. Yeah.
yeah, exactly. But there are physical invisible disabilities, a lot of them, and this idea that because someone looks healthy, and this goes to many, many, many layers of it, because then you have the example of fat people that will constantly be dismissed because whatever symptoms they present is just like, oh, it's because
No.
they're fat. It's an appearance of them not looking healthy because of this thing that will, dismiss a bunch of other things. And the amount of misdiagnoses that fat people get because of that is absolutely insane. So this thing of looking healthy or not looking healthy, or not looking healthy in the wrong way, goes to physical stuff.
Yeah, because here's the thing. I definitely look healthy because I'm very skinny. But oh my goodness, it's an illusion because people actually get
You
weirded
are
out
too
when I
skinny.
actually
You
yeah. So I
scare
got
me.
comments like, "Huh?
You scare me in the sense that I'm like, I genuinely sometimes I'm concerned that you are too skinny for your health. I'm like, do you, are you eating enough?"
You will not be the first one to say it. Not even the second. Not even the third. To say that. Addressing that a little quick. Yes, there was a jump scare that I got that I could actually be too low fat, have a too low fat percentage, but I found out that was fine, or at least kind of
Okay.
finish. And at least by my psychiatrist. And but before that I was panicking because I thought I could actually, uh, be getting to the realm of an undernourishment, and I have eating disorders, so that contributes to that. And and yes, I sometimes I can look a little too gaunt, at least, and people got a little scared, like they just see like bones, and I look like a skeleton sometimes. And but
Okay, you don't
regardless,
look like a skeleton. It's more really
kind of,
like, no,
kind
you
of,
don't. Come on.
kind of. I mean, my mom calls me skeleton, so.
Jesscat is saying that he
Okay.
has a story to share, but will make us angry. I want to feel angry. Do you want to feel angry, Himbi?
I'm always angry. So
Okay, Himbi is always angry, so it's just their natural state. I want to feel angry, Jesscat. Please tell me stuff. Go.
okay, but I will finish my point
Yes, you will.
while he tells his. Okay, even though I look apparently healthy, people actually get a little weird when actually I get exhausted after a walk, because that can happen. I can get to like my legs are in pain. Actually, I have knee pain that is kind of recurrent, and people just get weirded out why I'm a little too fatigued, and I'm actually. I mean, I'm not like saying like suffering like you. I'm saying like, oh my god, no, I'm not breathing hard. I'm just like dragging myself. That it feels like I'm dragging my kind of like my legs are too heavy. Um, and people like told me like you should do more exercise. Look at you, like you don't
Oh,
have no muscle strength. And I was kind of like, I just get exhausted in doing exercise, like because I already do a shit ton of like running, because I
and
have
biking.
yes, a lot of biking as cycling as well. So it's kind of like, dude, you want me to start? You want me to do exercise like 5 days a week? This is a because I know a lot, not your typical gym workout program, but for Christ's sake, if I also did that, I would be extremely exhausted, and you don't have the time to actually recover because I had to work.
Yeah.
So I just don't have the privilege, because here's the thing: gym program workouts, they're kind of a privilege thing, because you don't do that much in your job, so you just get in
I
the
can't even
gym.
do them. I can't be at the gym. I can't be with that loud noise. I can't be with the differences of temperature between
Mm.
the showering place and the exercising place. I can't with how many people there are around me. I can't with how much movement there is. I can't with the lighting that there is inside those places. Everything is hostile. Everything makes me overwhelmed, and I start melting down during exercise because of that. Because then I have also the pain from my body, which, is already bad as it is. And even if I try to exercise, because of the environment being so bad, I literally can't. And then I go to a doctor and I say, yo, I'm suffering from pain. And the first question they ask me is, do you exercise? And I'm like, I literally do not have first the time to exercise because I am literally always sleeping or working because I have to sleep so much because I'm always tired and I'm working all the time. Oh, but you always need to find time to exercise. I'm like, but it's not
Bullshit.
realistic. It's not realistic. I literally cannot.
Yeah.
And even if I could, I cannot do gym and I can't do individual sport. It's a problem with me. I need um team sports or something that is like
Oh
martial
yeah,
arts
same,
worked so well for
same.
me. I love doing martial arts, but because of COVID, I had to stop. And now I don't have the schedule or the energy or the time or the conditions to do it anymore. And it's literally the first thing everyone asks me. And I'm like, please, regardless of if I do exercise or not, if I have a problem, I need help. And for as much as exercise is going to help and even solve some of those things, I still need, to know what the fuck is wrong because something is clearly wrong regardless of that.
Yeah, but it's like it's their protocol. They just ask that, you
I
know.
know, but they could, like not get stuck at that and actually
Yeah, but
develop for all the other things that, there are there. Sheesh.
though, do you think they can actually break protocols? No, they're too autistic. This was
Okay.
okay.
Okay. Do you want to finish first, or do I start reading chat stories? It's with you.
Uh, I think I'm gonna finish.
Okay, then I'm gonna start reading
Again, yeah.
stories. I'm gonna start with Jazz Cats. He says, I was in my mid 20s. I decided to try to get to the bottom of why I was in pain all the time. I complained to the doctor enough times that they sent me to a specialist. I walk into the rheumatologist's office and she checks my range of motions, then gets me to strip down to my underwear to weigh me. Then, as I'm standing there in my underwear, she starts telling me about how I need to lose weight and that there's nothing wrong with me. I took up bike riding and running. I pushed through the pain and lost a lot of weight. And I'm assuming that he's still typing, but there's already so much going on here. It's
Oh
like, oh, you
no.
you need you suffer from pain all the time. Oh, that's because you are overweight, and that's actually a fear I have. I gained a lot of weight in the past 3 months because I had a surgery and I
Mm.
couldn't go out, I couldn't move much, and I was literally not working much. I was sitting all the time, and I started gaining some weight. And like, I don't feel bad about myself. I feel confident. I like how I look. I don't want to get fatter, but I don't feel like I need to get thinner. But I'm scared that I get to the doctors and they're gonna start go like, oh, you just need to lose some weight. You're starting to be like above the recommended whatever shenanigans they say. I'm actually scared of that, not gonna lie. I'm low key scared of that.
Yeah, yeah. Because this is still a wrong conception. Because fatness, it is not a health indicator. Because because there's like people that are genetically predisposed to be fat, and that's fine.
God.
It's not an automatic. It's not like it's not a. What do you want to say?
I was reading Tatsin Art's story, and it's even worse in what comes to fat phobia. Sorry, go on. I'll read it in a bit.
Um. Okay. It's not the only health indicator because there's like other factors that you just know. But why they're so hyper fixated on fatness, unless you live in a medical paradigm, they just shame fatness because it's an ultimate symbol of an malaise. So here's that. And also too much skinny, like, but even then, because I have this experience of being too skinny, it is not as the doctors don't get that much. They don't pound the red alarms if they seem that I'm too skinny. They generally just they notice, but it's not like the whole clinical judgment is going to be dependent on me being too skinny, which is very interesting. But then again, it's actually more dangerous to be very skinny. I'm yes, it's very, because you can actually go to the point of kidney failure. Like the organs are going to fail you because you don't have nutrients. You don't have like fat to actually survive, because you need the fat to survive. And so that's why it's actually dangerous to be skinnier than to be fatter. And it's very interesting that the physicians really they don't take that into consideration. I mean, why? Why? It's like when it's actually proven that it's actually more dangerous to be thinner than to be fat, and I'm just really bewildered by this. Um, yeah.
I'm gonna go back to chat stories. I'm gonna finish Chess Cats first, because he already finished. So he said that he had lost some weight, and then he says, "I go back 6 years later after my psychiatrist pressed me to go to a different rheumatologist because I lost weight and I was still in pain all the time. Turns out the first lady had completely missed that I had fibromyalgia." But I avoided doctors for the longest time because of how that first rheumatologist treated me. I'm probably misreading the medical terms because I know how they sound in Portuguese and I'm trying to do something similar and probably missing the English pronunciation. Yeah. I'm kind of scared that's going to happen to me as well. I don't know if I am kind of sus for fibromyalgia as well. Might be something different, might be something similar, might be a lot of things going
You
on.
are very sus. You are very sus.
I am very sus.
You are very sus. Yeah.
I am gonna go now to Tatsin's art story. I walked on a broken foot for weeks because my doctor told me my foot just hurt because I was too fat. He said I should just take lots of ibuprofen and go on his $450 a month meal plan to lose weight, but I would be allowed to eat all the lettuce I want. I begged for an x-ray, but there was nothing on it. I went to another doctor who pressed my foot in 3 places and figured out I fractured a metatarsal bone. Apparently it's common they don't show up on x-rays if it's a thin fracture, but it shows when it heals in 2 weeks as expected. 6 weeks in a boot and physical therapy and the foot pain stopped. The other chronic pain is another story, lol. I told that doctor that the podiatrist said I broke my foot. At my next appointment, he asked how my fractured foot was feeling. He made the air quotes gesture around fractured and rolled his eyes.
You made what? I'm sorry.
Air quotes, like aspas com as mãos.
Yeah, I got it, but
okay.
Wait, what? Like they're making
on the word
on
the word fractured is like on your fractured foot, rolls eyes. You know, when goes back to the doctor and it's like, yo, I actually broke my fucking foot and you are being an incompetent piece of shit. And the doctor is like, oh, on your like I had something similar happening to me, not because I was fat, but I went to do how do you say that? Ecografia. How do you say that in English, Rimbi? Do you know? Ecografia. No. Ultrasound. It's an ultrasound. There we go. I went to do an ultrasound because of a cyst that I had, and it was prescribed by my family doctor. I went to the doctor, and not only she was playing Candy Crush on her phone, which rude, honestly, but she starts asking me like how long ago I've perceived it, and I start answering, and she starts with going like, "What? I'm not listening to you. I'm not hearing you," and whatever. But like I was speaking on a regular speaking voice. I wasn't even non-verbal or semi-verbal. I was speaking pretty regularly, but as she started being very insistent and rude, I started losing my ability to speak. And well, so far you could say, okay, maybe she was just, on a bad day or whatever. Okay, fair enough. But then she asks me where it was. I try to say, she says she can't hear what I'm saying. I point to where it was, and it was in my coccyx region. So, like basically on my butt. And she answers me with, "Oh yeah, I'm gonna find so many things there, clearly." I'm like looking at her like, "Oh, it's my fault that I got a cyst in a bad place." And then she actually does the ultrasound, and she finds something because, well, there was something there to be found. That's literally the surgery that I had 3 months ago that I just recovered from, and that made me go 4 months without working. um and she says, "Oh, I found a little thing here with 8 millimeters," and just being an absolutely asshole. And I just wanted to grab her neck and just, like, I don't know, shake her or something, or throw her phone to somewhere, because clearly her fucking game was more important than whatever was going on there. It's just like this sarcastic and dehumanizing attitude, because I am young and I shouldn't have health problems because I look
Yeah,
healthy.
you should be healthy.
Yes,
Like
I
I'm
should.
trying to
I
find an
want
excuse.
to. Listen, I try to be healthy so hard, guys. I swear.
But like you should be working. Why are you finding excuses? Like why do your body is finding excuses to not work? Why your body is turning to an anarchist that says anti-work? No, you shouldn't do that. The body shouldn't do that. Why? Guys, fibromyalgia is they're helping the revolution, really. They're just making people to not work. They're saying they're saying anti-work. They're just like, bitch, if you cannot stop working by your will, I'm going to make you start working against your will.
Actually, though, it was fucking rude because, like, I put my surgery at the end of the school year so that I didn't need to skip a lot of classes. And 1 month before the end of the school year, my body was like, "Nope, you have literally a fucking infection going on, and this is gonna need to be perforated so that the whatever is inside comes out in the most painful experience of your entire life, and you're gonna have to wait an entire month home while that is not healing on purpose and then kind of healing until surgery." So yeah. My body was
Yeah,
absolutely fucking rude.
it was on that hell hospital, wasn't it?
Which one? No,
There are two hell hospitals actually.
the one where the one where I had the first bad experiences that I was talking about, just straight up outward ableism towards ADHD and autistic people, was not the same as this one. This last one is the one where you're working at currently.
Okay, and I have things to do then, I guess. Well, because I just remember, because on that hospital they were complaining about the first year shitty hospital. Like, I just went there, and what is the word? And the doctor that was um uh, that had an appointment with me, he was so rude. And then the other lady says like, "Did you went to that hospital?" And she said like, "Yes." That hospital has so much bad reputation. But okay.
Yeah.
Wrap up things. Not wrap up. Unpack things. About the healthcare professionals being condescending. From my experience, at least when I work at, it depends really. It depends. Yes, I met some of them that were kind of condescending. You know.
I mean, if that wasn't the norm, I'd be fine, because, like, there's bad professionals everywhere, and I can't expect all medical professionals to be excellent, but systemically, they are pretty fucking ableist.
Oh, yeah, for sure. Because it's just they're like, oh, here is we have a special needs child, or oh my goodness, that patient is so insert type slur, whatever. I cannot say.
Mm-hmm.
I think, or I can say actually, but yeah. Let's just keep this clean, please. Basically, you have that. You have the whole shenanigan, but it's just like they don't say to the patient. They say like to me or to the other coworker. Um, but what happens is there's clearly a lack of empathy in healthcare with all care professionals. Because basically, there's no teaching empathy in their course. No,
Mm-hmm.
they probably it should be expected to get that empathy skills. How to approach the patient in the training. I mean, on their residents. Um, is there a term? Residents. Their intern.
You
I want
lost
to
me
say
there.
internship, even though for physicians,
It is an
yeah.
internship.
Sorry, I'm saying that. Yeah, but for medics, physicians is different. It has if it's actually, I think it's residents really. Um, that they're expecting, it's expected for them to get more knowledge on how to approach the patient. But if
Mm-hmm.
you, the thing that you get from
I mean, but if the people that are
the
working there are already biased and fucking ableist, that's what
yeah,
you're gonna learn.
and
That's a system.
empathetic. Yeah. That's what I was going to say, and I was struggling. Thank you. Yeah, because and so we get in this weird limbo that okay, they don't learn in school, but they have to, so they learn in hospitals, but in hospitals they cannot learn because the healthcare professionals are fucking unempathetic and ableist.
I can never forget that story
So
that you
you
told
have that.
me about you asking a patient if they were comfortable with the procedure, and that the person that was guiding you in the internship starts criticizing you because you asked the patient if they were okay. I could never get over that one because it sounds
Yeah,
so out of every realm to me.
yeah. Uh, in their not to defend her, but the professor was not that bad. It was like it was not invasive, but it's like but you're inside a cabin, and I was getting probably too long, or her was getting too long to actually do the next step. So I was like, probably the patient is probably a little tired to be there. I don't know what it was my logic because but those are, I don't remember because I already have as a protocol. Like I'm going to ask the patient when I was going to switch the things in the during the exam, like because we have to switch things, get to do another procedure. It was a great, just just checking if they are okay. Because here's the thing: you're inside a cabin. It can be a little claustrophobic. I mean, and it's hot in there as well. So, I mean, there was some reason to actually ask if they're okay. And the other supervisor didn't say a thing. This one in particular, that she was very condescending, actually. Even the patients, she criticized me for that. I was like, are you going to penalize me for being a little empathetic? Like, I'm just being a little too gentle. I'm too gentle to the patients. And she was like very proponent of like, you don't have to be gentle to the patients. You have to explain the procedure, in very assertive way. When she meant by assertive way, actually kind of almost aggressive way. Um,
Well,
because it
sometimes I
was
wish the doctors did that to
like,
me though,
I have a
because what is medical consent in Portugal, at least?
oh, I want to touch that when it just got said that. Okay, I they actually Jessica, she asked you to actually strip you down, like and she did ask why she has to do that, because it was a little too like out of nowhere that
Invasive.
she say, yeah, evasive. Okay, that's my question to the
Yeah,
audience. Oh,
because and listen, it's really the thing of like I had so many things done to me in which the doctors don't tell me what they're gonna do and don't ask me if I understood anything. Like I had
okay,
an actual gynecological procedure done to me in which the doctor as I actually knew what was gonna happen, but I didn't need to, and it was actually the first time I was doing that exam. And while she's gonna start doing it, she's like, "Oh, you know how this works, right?" And I was like, yes. And she was like, oh yeah, I have the consent there for you to sign, but
she can do that.
I know.
She can.
I know.
Mhm.
Please, I know she can't. And she was like, "Oh, I have
I'll
it
just.
for you to then to sign. I just forgot to give it to you." And then I signed
Oh
when I was
no.
signing it. I
Oh
was like,
no.
"Well, it's a good thing that I actually everything went well and that I actually knew and that I was going to consent anyway, because if I wasn't, this was going to be a problem." And she was like, I mean, but you knew. And she was trying to soften it, and I'm like, a consent is given before the procedure, not after the procedure. And this one was very obvious. But other times, like I had an allergy test to do, and this one I actually had no idea how they were done. So like they start putting like the liquid on my skin for it to react and to compare with the one that was not supposed to react, in case I didn't have an allergy. And how it works, for those that don't know, they kind of punctuate your skin for a little bit of blood to come out, like a tiny little bit, to see if it reacts or not with the liquid they put on it. But I didn't know that's how it was done. So like they were doing the markings on my skin and I had no idea what was going on. And she just picks up the little needle thing that is gonna do it, and she does it 15 times in my arm, which was what was needed for the procedure. And I just stood there with liquid starting to burn in my arm without being told that she was gonna do that. And I just stood there like I went nonverbal on the spot. Like, what the fuck is going on? No one told me this was gonna be done.
Okay.
And like I saw that then the other nurse that did the exact same thing to other patient in the same room, she told him everything that was gonna happen. But to me, nothing was said at all from the moment when I entered. The only things I was told was what I needed to do for them to be able to do it. That was it.
Okay. I'm guessing that they do that in order to make the patient more compliant, so because they're not anxious about what is going to happen. Don't take this as very. It's just a wild theory, I think, because that's my guess. Um. Okay. Consent. Here's the thing, because we can. It's wild because actually I explained the procedure. So that the fault that there's healthcare professionals that just push you to do the procedure anyway, and they don't explain you anything that is going to happen is a little too abstract for me. Um, I'm bewildered by this because this is not good practice. Um, you should always explain the procedure beforehand. You know, even though I met some health professionals that they don't do very detailed, it's just like you have to do this and this and this. I mean, yeah, I mean it's better because you need the patient to comply. So I guess you have to be as simple as possible. But at the same time, you should also provide certain details that what is going to happen, especially to the autistic people, because we can actually because for example, okay, you're going to hear a sound, and they're going to, if every autistic people will ask, but what sound? How the sound is going to sound like?
Oh, but I
And
wish they just told me that I was gonna hear a sound. The problem is that no one ever even says that. Not even that. I'm not even
I'm just,
talking
yeah,
about getting detailed on in being nice to disabled people.
but listen, I did the project that was about that, so I'm just getting too more deep into the question.
Okay.
What you happened was basically even worse than. They didn't even did the bare minimum. They just really just coerced you to do the procedure. That's unethical. Because imagine if something went wrong, you didn't consent to that. They're going to get into medical negligence there.
Yeah.
Uh, and that's why I could see, and I could see a vision that I have of nurses. This is actually very interesting because actually I don't have that much positive vision of perception of nurses. Uh, I always kind of think them as a little regressive because I just have the image of them pushing the patients to do the procedures like I'm just going to do you insert the IV tube on your arm, and for me, at least from the memory that I have, they sound a little aggressive in how they do it. especially if you're taking into account psychiatric nurses. But I think it's also more an account of me watching media that has about psychiatry as asylums. There's a lot. I'm probably getting to a tangent here. Uh, well, it's not that much of a tangent because I'm talking about institutionalization, which is also a problem for us.
Hmm.
But I think it's another topic. But what I'm saying is, I mean, you're an object basically. If you cannot consent to the procedure, you're an object.
Yeah, but that's the
Basically,
thing.
you're done.
A lot of times that's exactly how I feel when being seen by a medical professional. Even when I get out of there and I'm like, huh, that wasn't all too bad at all. Like I actually felt okay during that. I still feel very objectified a lot of times because I feel like I'm being treated as a thing to be fixed and corrected outside me being a person. So me being a
That's
person,
medical waste for you.
yeah, always comes in the last of their concerns. So when they're saying something, it, even when even when they're saying even when they're being the most helpful they can be, like, okay, so you have this and this problem, you need to do this and this and this and that. Like they're being very pragmatical, and I appreciate all of that. But there's always such a coldness to that. There is never a care for how I'm reacting to things, never a care for if I'm actually getting it most of the times. There are a couple exceptions, and when I felt those exceptions, I nearly started crying in front of doctors and nurses just for the fact that they were treating me like a person and I wasn't expecting it. That's how messed up it gets. I remember not too long ago, I went to a doctor and he gave me some antibiotics, and it was right before I needed to do that painful procedure to drain my cyst. And he saw how bad it was, and I was complaining that it was hurting and all. And he gave me the antibiotics, and he told me that if the skin was removed, or if it wasn't better after 3 days, I would need to go to the hospital in urgency, and it would be to and some procedure would need to be done to it. But during the whole time, I felt like he was genuinely concerned about how much it hurt or how I was feeling and what I needed to do, rather than being like, oh, you do this and this and this, and if this happens, it's this, and you go home. No, I felt like he was actually there and trying to help and finding solutions, because I was like, oh, but I need to go give classes, and I this and that, and I have a surgery in this day. And he was actually taking those into consideration, you know, and trying to see with me what the best options were for me, i- taking in consideration all of that. And that made a huge difference in the way I felt treated. It wasn't even that much of a difference, and he didn't even lose time with that. My appointment wasn't bigger than, if he didn't do that, really. Maybe by a minute at most.
Okay. Okay. Several things. And before you interrupt me again,
Sorry.
I just forgot the first one. Gosh. The more I think of it, the more I forget. It's amazing. Medical gaze. Okay. So we're talking about being feeling that you are being objectified, even if
If they're
the
being nice
doctors were still
or
they're still being
helpful.
nice. Yes, if they were being nice and helpful, you still felt objectified. Well, there's a term for that. It's called medical gaze. It was coined by Michel Foucault. It defended that under the medical paradigm, there's like a medical authority that objectifies, see you as a person that needs to be fixed. Basically, that's it. and observes you under that model. You're just a person that has symptoms, and there's more to it, of course. Like I didn't read the whole book, for Christ's sake. There was no time. um, but it is that, and it is under that paradigm that we felt objectified with just a person that they are observing the symptoms.
It's not
Um,
even a person, it's an object, a subject at most.
Not subject, object, really. Thanks for the correction. You are an object of their procedures. You're an object of their observation. You're an object of their clinical judgment. Do you think that they don't take into account your personal identity? And
Oh,
of
they
course,
very much do, and they need to judge if I am wearing something below my shirt or not.
no, no,
I'm not even kidding. I wish I fucking was.
no. What? Still, you don't prove my point. You don't prove the point because they see you as an object. Like, go to, of course, don't you think that that people judge objects? They don't judge objects.
During,
You know.
have you ever heard of sarcasm? You know, we know that we are all autistic here, and clearly you don't understand. We don't understand sarcasm or anything. Neither you or I. Like we're absolutely stupid. God, sorry.
Okay,
I'm fine, guys.
I'm also fine. I'm not dying here. Nobody's dying.
No,
We're all
everyone's
alive.
fine. Yes. In this
So, but
economy?
this is who is fighting this economy? We are at war.
Uh,
Oh my goodness. Okay, speaking of which, speaking of war. Just kidding. That's not going to be worth talking. Okay, I'm back. Okay. Um, so here's the medical authority that you cannot question because power dynamics between the physician and the patient, which is very strong to this day. Because here's the thing, at least from my experience in the clinical setting, um, there's a lot of personalization. You're just like, oh, like you can have an hearing loss, but they don't take into consideration. Um, they also take into consideration that hearing loss is going to be fixed. That's the thing. They don't accept that as like an actual disability that the person can be fine with. Uh, but since it's mostly acquired, you know, yeah, there's no social model. And even with kids, that this is more noticeable with kids because there's kids like the day you are born with hearing disability, you know. And there's like since the very beginning, uh, um, a protocol to actually detect those early, you know, those things early, and actually make an intervention on those, which most of the times it's hearing aids or something similar. So there's like since the very beginning, there's no like uh, that much open space for acceptance if they do actually are born with a hearing disability. You know,
mhm.
there's like they go right to out of their way to get immediate intervention when it's detected early because there's actually a protocol that you have to do when you are born. Um, and there's like no conversation for the fact that probably I mean the kid cannot speak for himself, but it's the parents, for example, if they're okay with the kid being having a hearing disability, which can happen if the parents are deaf. um and this is actually a conversation. There's actually a debate behind that. Like, should you? Because at least in theory, you have the right to actually not do that protocol. Like, you can miss the appointments. Really, nobody's going to stop you. But there's like this concern by the physician, like, well, but they are not going to learn the language. They're not going to acquire language if they are not intervened. If they are not subject to intervention, you know, they should have their hearing fixed, but it's not really fixed. But whatever. And but that's because because if you go back to the social model of disability, it kind of coerce you into getting intervention because literally the world is not accessible. There's not accessible for the kid that is born deaf or has a hearing disability, whatever the term that you prefer. Um, I don't know. I just found like that's the big dilemma that I'm here. Like, Yes, I have the duty as a audiologist to perform the exams to detect the hearing loss early. But I should just like if there's actually positive for that, I had to do intervention, and sometimes I'm not apologist of doing it because I think that it should be up to the parents to even it's a little controversial to say that the parents should choose if the kid gets hearing aids or not, because it's actually crucial. It's actually crucial time that you have to get hearing aids, otherwise they're not going to acquire all the language.
Yeah, yeah, yeah.
So yeah, it's tricky. It's really really tricky.
But there is no
There's a lot of
conversation about it because, listen, even if the answer is the kid will need it because otherwise there is not going to be a certain amount of development that the kid needs or whatever, there is still not enough conversation with the parents as to how they feel about it and why it's
no.
being done and all of that. It's just, oh, this is going to be done, whatever, bye. And nothing
Yeah,
gets
yeah,
really
yeah. Here's
transmitted.
that. Yeah, it's like because they assume like, and this is the thing. Most parents are like, okay, should do it intervention. Yeah, unless for economic reasons. Most of the time it's economical reasons. Um, there's no lot of conversation because they just assume because most parents are not disabled. Um, so they of course they're going to have the kids uh, being subject to intervention. But there's like yes, a portion of parents that just don't want that. At least if I was going to have a kid and if they were going to be born if they were to be born deaf or with a hearing disability, I mean, I'll probably will be a little critical, you know. But it's tricky. I can't guess why it's tricky because the
Yeah, it
world
is
is too
tricky.
inaccessible.
It is tricky.
It
Uh,
is tricky.
I have two things to say. One is about that, the other one isn't. I'm going to start with the one that isn't about that because I am too shocked. That being said, my friend once asked a new medical provider, what is your concept of health for someone who is chronically ill? And the doctor said something about losing weight and not giving up. My friend did not go back, well, obviously. That's insane. The way that people with chronic illnesses or disabilities get treated, and this is where I'm going to link back to what you were saying, which I find very interesting that you brought up the case of kids, is very similar to the way we see kids. We are seen as having no autonomy whatsoever over our decisions, regardless. And this goes for invisible disabilities or otherwise. From the moment that you show any sign of not being in the norm or any sign of illness, any sign of acting socially different, you are gonna be infantilized on the spot. And let's not even discuss, or maybe let's, the way that we as a society see children as not having body autonomy. And we are put in that same goddamn category, and suddenly we are treated as kids in the bad sense of the word. It's
Um,
absolutely insane in some cases
we
how
use
much we don't have bodily autonomy at all.
oh yeah, yeah. Oh yeah, yeah.
And I'm going to give the
Because
case of, sorry, just to add one more thing. I have a student that I'm pretty sure she suffers from chronic pain. She has been having classes with me for 3 years now, I believe. She must be around 10 now. So she has been suffering from chronic pain since she's at least 7. If I am right about this, which I probably am, because that kid has been crying in my class of pain and not wanting to go home because she wanted to have a violin class. Literally crying with pain and shaking in front of me. It was one of the most heartbreaking things I've ever seen in my life. And just how much this kid is dismissed on everything she says because she is a kid is insane. And it's kind of the same thing that I sometimes feel the way that doctors and sorry, the way that adults dismiss this kid feels like the same way doctors dismiss me. It's literally me being crying on a room in front of the doctor saying I cannot take it anymore with how much pain I am feeling. I need something, and doctors telling me, well, we can't really do anything about it, can we? I mean, you need to probably rest a little bit more and do some life changes, and we can give you some medication that might help, but that's
Look,
about it.
yeah, there's limitations on the model, on the medical model, really, because of that. Um, Jesus fucking Christ, what I wanted to say. Hmm. Okay, loss of body autonomy. Okay, there's actually a fear that I have is because I cannot mask that well. I can be go non-verbal sometimes. So go non-verbal and imagine they can actually do a procedure without my consent because I could not consent because I was non-verbal. That's scary. Um, and but what happened most of the times is like, what if I'm not able to mask? If I happen to be perceived as an intellectual disabled person, it's a kind of a far-fetched thought, but sometimes it occurs to me. Like, because I was already treated as such in my on the past. So imagine if I was perceived again as such, what it would happen to me. The approach will be different. It's going to become more condescending. Whatever I say, probably they're not going to take it seriously. And here's the thing, actually I have knee pain, and I'm avoiding going to the doctor because one, they're going to see on my clinical case that I am autistic. Um, that's not beautiful. And I was already judged by being autistic because they thought on my clinical case I was autistic, and I was and the doctor was responsible to fulfill the forms to get my
Yes, if you're
um
autistic, you can't have problems. You can't have knee pain. Your knee, totally fine.
no, because no, I'm talking about my previous past trauma with
Mm-hmm.
seeing my diagnosis on the clinical case, on a case history, because they actually they refused to fulfill forms that were necessary to get into college, because the forms were related to my
Mm-hmm.
communication skills. Here's that. So there's trauma, and I'm afraid that I can be judged on that. Like, listen, my family doctor is very fine, actually. She's very fine. This is the thing. I have no complaints about the decisions that I've encountered lately. Well, except one. Um,
Oh, there's that bitch, but that's fine.
Now she retired. I was actually so happy when she retired.
Oh, understandable.
She has a history with being condescending to disabled
God,
people.
I
Actually,
have one doctor at my health facility that when she ends her internship and she goes somewhere else, oh my God, I'll be so happy. She's not
yeah.
she's not a bitch, but she is so dismissive. It's like I get there and I'm like, I'm suffering from pain. Hey, have a here one exam, and I'm like, okay, that's barely related to what I said, but sure, I'll do that. What about my pain? Uh, oh, I guess I could give you some pills. And I'm like, thanks. It's like every single time I go there, it's like analysis, and I'm like, well, that value is not looking very. She's like, oh, everything's fine, but what about that value, doctor? It's not inside the the values that it should be. Oh, I mean, this can mean that maybe you might have some kind of whatever thingy, and I'm like, then shouldn't that be tested? And she's like, I mean, I guess we could do this
Imagine.
exam, and it's literally me having to ask her. Like, I literally went there like with an actual allergy, and I'm like, shouldn't I be taking medication for controlling that, considering that I'm literally waking every single day with lack of air and I'm suffering. I had asthma, uh, um not actual asthma, but like indicatives I could develop asthma in the past, and probably I should control the allergy so that it doesn't develop into asthma. And she's like, oh yeah, maybe that could be a good idea. I'm gonna pass you some things against the allergies there. What were you taking before,
Oh my
really?
god.
And I tell her the name of the medicine, and she passes me the paper with that. I'm not kidding. I literally had to tell her what I was taking and why, and going like, shouldn't I be taking something for that? Because I remember doing that before. And she's like, yeah, we could do that.
She's collaborative. She just depends on the patient to the clinical judgment. Don't judge, Toad.
Oh my god, but I am not the doctor. I don't need to know these things. I'm not the one that needs to tell her, yo, maybe I have this problem considering the values that I'm seeing in my goddamn blood analysis.
It was so funny. She says like, "Oh, everything is fine." Oh, and you're still like, "But our value is out of the standard, you know." Oh, she's like, "Oh, it's some diabetes shit. It's okay." Very
Listen,
nonchalant. She just said, "You got diabetes."
it kind of felt like that. It's like, oh, everything's fine, but my allergies. That's literally where I went to do the blood tests.
Okay.
Oh,
Yeah.
when she
That's
when she
so.
gets when she gets out of there and I actually get my actual doctor back, maybe if she's not having another kid anytime soon, please stop having kids. Uh, maybe I get my shit solved.
Oh my god. Okay. Can I back to my knee pain? Because
Sorry.
I've yes, I'm going to have knee pain at this point. Um, because actually I've been avoiding going to a health facility about my knee pain. Not because it's not that recurrent. I mean, it's recurrent, but it doesn't appear like it didn't appear. My knee pain didn't appear like for like a year at this point. I think because I did nothing for like a year to actually to that shit recurrent. But then the last days on these previous days, I was doing some shenanigans that were a little too much for my left knee, and I was like, oh shit, I have this thing. Shit. I think you were solved with time, but no, you don't get fixed with time. You just get worse. I don't know if you.
Yeah.
And I was like, I have this since I was 15. I am 22.
It's been yeah, 7 years
7
is a
years.
long
I think
time.
that's a.
Yeah, it's 7.
It's 7. Oh my goodness, it's 7. It's that long. No, no,
Yeah.
it's because
15 plus 5 equals 20 plus 2 equals 7. That's how my ADHD brain did it. Hello.
yeah. I just did it because I memorized the gaps between the things. This is weird. Yeah, 7 years, and I kind of been dismissing this for 7 years. It seems a little serious to actually because
mean, go on.
and this was because there was a shit fucker that was demanding us all a group. This was a group of 4. We were in physical education class and we were doing acrobatics, and she managed to find a very hardcore exercise that we have to all 5, I think we were 5, have to do, and we did. And I ended up like in the top of like carrying 2-3 bitches like with my bag. And then my knee was like it got
I give
fucked.
up.
And I
I
was
give
like,
up on
oh.
this life.
I was like, I felt a weird sensation on my knee like for a week, but I could not describe if it was really pain. So it was like just a weird sensation. Like every time I would just bend and then stretch again, I was kind of like, this feels weird. I don't know what happened here.
Oh, boy.
And I just dismissed it because I thought like this might be fine, but it isn't fine. I still
No, it
have this weird
clearly
sensation.
isn't.
And then I have this pain. But I could not describe to the doctor that, I have this weird sensation. And they're going to like,
That is a thing that
what is the
happens
weird
so much.
sensation?
We can't describe things to doctors and they start speaking over us as if they knew what we are feeling. And we are just left there like, that's not what I mean. But then they don't let you speak. They start speaking over you. It's a thing that happens with all kinds of medical professionals. They interrupt my sentences every time.
Yeah.
Like, and I don't mean when I start like talking like when I'm here on the podcast and he literally has to stop me because I start talking nonstop. No, I'm literally talking about short sentences of like 6 words, and they can interrupt me on short sentences like this. I'm not talking about me going
Okay,
nonstop.
yeah, there's only like, so I feel this thing on my leg. Do you mean pain in your leg? It is.
Yeah, it's kind of like that, but yeah. On dismissing things for years, yes, I've been dismissing my fatigue for 3 years now. I know exactly when I started feeling it or when I first noticed it, which was immediately after my master's degree. I finished it. I went on a small choir internship after that, and I was still feeling okayish. And I remember right after that, I started feeling more and more and more tired. I was sleeping a lot. I didn't know what was going on. And at first, I thought, and it was partially right, that it was because of the lack of energy drinks. I drank so many energy drinks to be able to finish my master's. And I actually got kind of addicted to it, and I had to very slowly reduce the dosage of it because I was constantly getting headaches if I was not taking them. But like, after 3 months maybe of not being on energy drinks and not getting headaches and still getting, just feeling sick all of a sudden, feeling like the room is spinning, feeling constantly tired, feeling constantly sleepy. I thought, okay, maybe this is some kind of, I don't know, maybe anemia because I was eating so poorly during that whole period. Maybe something is wrong with my blood values or something, and that's why I'm feeling tired. And I went to the doctor at the time. I explained that after I finished my master's, I was feeling like that and that I was feeling very tired, and then I had some symptoms that could point to something like that. And if I could, I wanted to have some blood analysis. And at the time, the doctor tried to go like, oh, but I mean, it's normal that you feel tired after a period of, a lot of work and all of that. So maybe you just need to rest. And I'm like, okay, but I would still like to have those analysis if that's okay, which she did pass. And the thing is, nothing was fine in those analyses. But when I went there and I said, well, I'm still incredibly tired all the fucking time, they said, well, you so just need some rest. And I repressed this memory so hard that I didn't realize up until a couple weeks ago that, oh yeah, I've been feeling like this and I did try to do something like this 3 years ago and no one fucking cared. Huh. Because I was like, yeah, I never really tried to solve this. And then I had to stop myself and go like, no, you tried to solve this. No one cared. You did try to solve
Yeah.
this. Stop repressing memories and gaslighting yourself like that. You did. You just didn't remember because it was easier to believe that you didn't do everything that you could than actually face the reality that people didn't fucking care.
Yeah. Because this is this we had to talk about the chronic fatigue syndrome and fibromyalgia. Both diagnoses are they're not taken into account because they don't have symptoms. They don't show uh, they like most of the times they complain about, at this from fibromyalgia they complain about generalized pain, and with fatigue they complain about a lot of fatigue. But both things, the blood tests came normal. There's no occurrences in the MRI exams. But so the physicians go like, go straight to judge the patient, like, okay, so probably should just rest. Because this is actually the model. This is actually according to the psychological model. They think that also the patient has to do something to fix that problem, which is they have to change their behavior. Something is wrong with their behavior. They're not behaving right to, because that's why they are tired or they feel pain. This is where I know this sounds a little, just to explain why they might judge you that way. That this is actually the actual model. So they of course they're going to say like, you have to change your behavior. Your behavior is not healthy.
But
They
I
don't
had
take in
already done
consideration.
that.
So no, you're not changing your behavior. Stop. You should try hard. I'm the physician right now. I'm clear the physician. Um, Now, getting serious, they don't take into consideration also the social context, because those both conditions are perfectly prevalent. They are pretty prevalent, and they're incredibly misdiagnosed, and they both have a lot of connection with the actual system that we live. We live in a very productive focused system. We are always have to be productive. We are being, our labor is, we have to pressure to sell our labor force. So, and there's a lot of stress and risk of burnout. There's a lot of physical and mental overwork. Of course, there's going to be a high chance to develop those conditions and other occupational conditions are not taken seriously. Because the medical model has limitations. They don't take into consideration the social economic context. They don't take into consideration that, living capitalism, you have the pressure to overperform, overdoing it for the sake of getting the greens.
Sorry.
And
I messed up here. That's why I was apologizing with computer sound and stuff.
this is ASMR. Remy runs about medical limitations of medical model and told us
No, I was literally checking Tatsin's channel while we were rambling, and it started playing because the VOD started playing at the same time. Sorry, I was curious.
What did it start to play?
It started
What you
to
were curious?
play.
What you do?
I was checking Tatsin's channel because I don't think I've ever been there, and I was checking her pronouns and shenanigans, and it just started playing. I'm sorry.
I didn't listen to it. Like,
No, I didn't want to. I just wanted to check the channel.
there you have it, guys. There you have it, guys. So really having.
Why are you apologizing, Tatsin? I was the one checking in. Because I genuinely forgot to ask your pronouns a while ago when I was sharing your story, and then I was just like, oh, I'm just gonna check the channel and probably see and it just started playing automatically while I was reading the introduction that literally starts with she her.
Okay.
Sorry, go on, Ribi. I did my.
So she's apologizing for having audio on the channel that played during the podcast. She should apologize for that. This is so funny. I'm so sorry. I'm having a blast here. I'm having a blast because Todd is so pouty right now.
I'm just slightly ashamed of my incompetence at multitasking in these 2 seconds. I'm usually so good at it.
I cannot multitask to save my life. That's why I'm just like looking at the wall like I speak because I cannot do anything.
No, I am answering chat. I was checking stuff. I was closing tabs. I was listening to you. I was doing all that, and then I got distracted for 1.5 seconds.
I love that I'm third priority on this task list.
It's very important. Our chat is very important, Rimbi. You don't understand. These people are very important.
Okay, fine. They're like, they should be first priority and I should just be the background.
Be very sorry for the audio that we did not hear / notice. Oh. But
because I didn't hear it as well. That's why I was finding odd.
No, but of course you didn't, because it's my sound. Basically, the way I'm doing this, Rimbi, is that when you speak, it goes through my computer audio on OBS, and what I was listening was on my computer audio, so it goes to OBS. It doesn't go to the call to you, because what you're hearing is what comes into the mic as I'm speaking. So you wouldn't hear that. That's fine. Okay, but the other peeps would.
Gotcha. Where was I?
Sorry.
You keep interrupting me, and I was like, I have limitations of the medical model. Okay.
Hello? Rimbi? I'm out. Okay. Their system just crashed. It's amazing. I interrupt them, and then technical difficulties. Rimbi has a very bad computer. And shenanigans. Yeah, the medical module. Me and Rimbi actually had several discussions about the medical module and how much, which they were saying, how much it is not in tune with, just with the fact that you are working in a field that is a service for people, and people need to be treated as people. And about the question of social context, it's particularly interesting how those play when you are trying to get something out of medical professionals. Depending on who you are, you're going to have different answers. And not only that, but for example, you are in a situation in which you cannot afford to, have a healthy lifestyle. They'll just tell you to try harder, and you are tired and you don't have the money to get the meds that you need. No one fucking cares. It's pretty sick.
Okay, they can hear me now.
Yes, and Jazzcat is just being cute. Jazzcat just said, "I just want to say that I'm so glad that you folks exist." That's it. That's it. That's just Jazzcat for you.
I'm speechless.
Himby does not know how to deal with affection, Jazzcat.
mm, well, I appreciate the comment. I am glad that you're present. I mean, seriously.
Yes. Usually, today we also have that's in here, but usually it's really mostly you, me, and Jazzcat ranting about stuff.
Yeah. So yeah, we appreciate your support, really.
Hell yes.
This is the most genuine that you can say, because I am sounding very sordid right now. I'm very aware. Not because I
We
was
know you're being
focusing.
genuine. We know you're being genuine. Don't worry.
Well, you're talking about medical model because I was interrupted by the fucking computer this time. Yes, yeah. There's a lack of tune with the actual current system, because there's a thing. If you're at least there's actually yeah, if there's actually fields of medicine that are more in tune with it, actually take more into account the social context, but I don't know. I think it is, I don't remember which area, but most of the fields, they don't really they take that much into account. They really follow the medical model, at least. Yeah, I can only speak for the otorhinolaryngology. Oh, for Christ's sake, I don't know how to pronounce this in English. Ears, nose, and throat specialty. I cannot. And basically, it's pretty much like, oh, you have an infection in your ear, just get fucking fixed. Which is fine. I mean, there's no like that much of a social context for your infections unless you just happen to be very prone to infections. I don't know, but for example, there's like a condition that is very prevalent. It's benign paroxystic. Goodness, I cannot do it. I don't know the name in Portuguese, but in English is going a little difficult. It's like vertigo that actually happens when you are in your bed, like just roll. Just for example, move on your bed, like move your head in your bed because you have to change the position, and you get, or just you have to stand up, and then you get vertigo. It's very intense vertigo. It can actually make you unable to work because in types of jobs.
Maybe that's what's been happening to me every single day of my life.
you feel nausea and very dizzy.
I used to as a teen, though. But it was anxiety.
Yes, it was. But it can actually make you unable to work. And
certainly did.
And it was like, there are hospitals that there's like cases of patients that they complain about, oh my god, I'm so dizzy, like I like it goes like I'm in bed, or I'm turning my head very suddenly in my job, like for example, people that drive, for example, and some doctors, they just prescribe them the medication that just relieves the symptoms. But it doesn't get fucking solved, because there's like crystals that are outside the place, because you have crystals in your names, for Christ's sake. Oh no, I can't remember even the organ in English.
What do you want to
Yeah,
say?
but basically it's that the crystals are all over the place, and the crystals make you dizzy. That's what you need to know. And you need maneuvers to get that back. What happens when is like some, even most hospitals, they do not do those maneuvers. They just give you medication and just send you home, and you just hope that you get better. That's my experience.
And that you don't get secondary effects that stop you from working. The amount of medication that I was given that is like, you go read what it actually does and the possible secondary effects, and it's like, oh, you might just not be able to drive because you might get, problems with your vision or sleepiness on top of the sleepiness that you already have, and it's not recommended that you take this medication while you're driving. And literally, me on the doctor office before getting this medication, I drive more than 10 hours per week. Please do not give me medication that makes me unable to drive because it's required for my job. I'm a teacher. I shouldn't be
Another
have to drive that much, but I do.
another evidence that they're completely alienated from the context. Yeah. Um, there's like another topic. Like yeah, basically. But I was talking about people just getting staying hope without actual treatment, which is the maneuvers. Um, yes, because my mom actually she went. She had a case of that condition of vertigo, and she went to the doctor, the ears, nose, and throat doctor, and she was prescribed that medication. And I said, like, Mom, you're not going to get the thing solved with that, Um, sorry, I'm reading that message.
I wasn't confident that I could read it out loud. That's why I sent it.
Dystonia post-orthostatic cardiac syndrome. I heard that one. It's kind of, yeah, I heard that one, but I'm not really sure what it is. Like, because I read up a while ago, and I'm not remembering which. It has to do with I'm not going to guess. But I actually had to do the maneuvers because she was still getting dizzy even with medication. I was like, I had to do the maneuvers that I learned like a few weeks ago at the time, and after some of them, like after because I had to do some sessions at least once a week, and after 2 weeks she got better. She didn't have the symptoms. The crystals were putting back into place with the maneuvers that I did. This happened. The physician didn't prescribe a maneuver, so I saw that her son has to do them, which her son happened to be a trained audiologist at the time. This happened.
Ridiculous things be happening at medical stuff.
Yeah, her luck was that her son was actually learning that shit in school. Uh, because I'm not the wild about what you're saying, dude. That's wild shit.
I didn't get it, sorry.
And that's why I'm not that much bewildered by what you're saying, because there's like wild shit that just the others don't care.
Oh, yeah. Listen, I know, but when I give my examples, it's like this amount of bullshit happened to just me. I can barely imagine what happens to other people. And like some of the shit that happens is very clearly and outwardly ableist, and other things are just like, it's like it's a classic. I mean, no one ever thinks that a woman is less worthy than a man, but if a woman is talking and a man talks over her, no one thinks anything of it, but the other way around, then she needs to know her place. It's this kind of implicit things that sometimes happen with ableism in medical things. Like sometimes it's very outward and very direct when a doctor asks, or when a nurse asks me, does that even do anything when I say that I take ADHD medication? It's very outward. Or when a doctor asks me if my autism it's just light, right? It's just light autism. She used this expression, when I'm telling her
autism.
yeah, when I'm talking, she used literally lev light. That's the term she used. Um, when the topic at hand was not related to that, she literally just asked me if I had anything to add to the list of allergies and ADHD. And since ADHD was there, it was a neurodivergency because of the med. I was like, well, if this is relevant, I don't know if it is, just so that you know, I'm also autistic. And she starts coming up with, oh, but that doesn't really matter, or as in kind of developing, because she could have said just like, okay, that's not an important thing for me to know or something like that. But no, she just starts going like, oh, but it's stuff like, it's not really noticeable, right? It's not gonna be a problem, is it? It's with this kind of almost mocking way of speaking, like that's very outward. But when you have just things that no one is really saying anything, no one is really actively doing anything, but it's very clearly there for when, for example, you try to get help for something, but you are dismissed because in your file says that you are neurodivergent, or because maybe you just don't look like you need help or stuff like that. There is implicit ableism that very much affects our lives, just as much, if not more, than the outward ableism. It's just very much harder to spot and very much harder to fight, because when the doctor is fucking rude, you can just write a fucking complaint with the goddamn words and everyone's going to be like, that's fucking disgusting. Like, I'm sorry that anyone talked to you like that, which has happened to me. A nurse called me asking how the services were, and I described some of the things that were told to me, and the nurse was like, well, if that really happened, I am so sorry that you were treated that way, because that's not conceivable. And I was like, well, thank you. Appreciate it to have some validation at least. But when it's, just
Microaggressions.
yeah, it's literally microaggressions. It's
Yeah.
it's very soft. You can't
How do you
really.
describe? Yeah, how to describe? Yeah, how to describe, like, because it also has to do with our empathy, because we, um, or some level of rejection sense to the story. I'm guessing, because I sense that the professional is being consent to me, but I cannot really describe. I just have this weird feeling. I don't know. It's like they're just being concerning, but I don't know how I'm going to describe why I'm being concerning. And there's actually an instance with a psychiatrist of mine. Actually, they used to be my psychiatrist, and he was also my mom's psychiatrist. Um, at the time, let me see. Like, there was actually, because you're speaking about a while ago, you were speaking about things that they asked you that were not necessary, right? That were kind of rude. Okay. Yeah, they asked me because probably my mom said something. They asked me about my sexual orientation. That is the thing that happened. He was asking me my sexual orientation because they thought I should have a partner or something. I should have a life, in relationships.
Yes, because you are autistic, and that means that you are not sociable, and that means that you need to try to be sociable, and therefore you need a romantic partner. Goddamn, so many leaps in logic.
It's like, it just motivates me to write my essay on sex on the disability. Really just motivates me, because like there's this pressure that autistic people should have romantic relationships at all costs. That's why we have the show like Love on the Spectrum, because like it's because I just got delighted on the politics of that show. Like, let's just I will not speak about that. It's not the time, but just to get you a grip of this. It's like they think that autistic people should really find a romantic partner so they can get like less autistic or something.
Well,
I
jokes on
kid
them,
you
I have
not.
3.
You have 3.
I
You
am
have
polyamorous.
3.
But if I say that to a medical professional, well, be careful, because those bad sexual transmittable diseases or illnesses are going to get into your blood. And I'm like, condoms.
It's the same number, I think.
Having
I think it's the same
sex with a fabs, not having sex with your partners. So many options. So many options.
Speaking of which, can we talk about the reproductive healthcare? Because I think there's also a very productive field there, I think, in terms of validation.
Well, I was questioned on stuff that felt so absolutely judgmental. For example, when I stopped taking the pill and went back to condoms because the condoms were affecting my mood swings. The condoms, the pill was affecting my mood swings a lot. God dang. Sorry, I'm a little bit brain dead. Basically, what was happening is that I had a very natural and organic cycle overall. And like, so if I got sick, for example, my body would automatically delay the period a couple days to give me time to adjust. It was pretty nice. My period was pretty nice all the time, and I didn't get a lot of mood swings. I didn't get a lot of pain. But once I started having a more or once I started having a relationship in which I had a sex life going on, I started to take the pill because I didn't want to be, only relying on condoms. I was still relying on condoms, but not exclusively. But I started finding that I got a bunch of mood swings. Like when I stopped taking the pill for those days for your period to come, I started being absolutely insufferable. I started feeling like a lot of times I wasn't acting like myself. And in most of it was, I actually stopped taking it. And I know this is going to sound a little bit paranoid, but you know how there was all that thing about the COVID vaccine because, oh no, it's causing so many health problems and like whatever, which well, it's what it is. And you start reading what the pill actually has in terms of secondary effects and the risks that there is to it, and you're like, well, I am 10 times more likely to die because I'm taking the pill than for taking the goddamn vaccine that is making everyone go absolutely bananas. I maybe should reconsider this, and I was already not feeling so well by taking it, and I was like, I mean, I could just, go back to condoms. And I went to the healthcare facility to get condoms for free. And I said that I stopped taking the pill, and they asked me if I wanted them, and I was like, no, I'm not taking that anymore. I'm gonna go back to condoms. And they start like asking, but why? And I'm like, well, because I wasn't feeling all that well. And the thing was, when I stopped taking the pill, suddenly my mood got so much better, so much more stable. I didn't have all those mood fluctuations that I was getting for some fucking reason. It's just a little hormone, but God, that little hormone was messing with me. And yeah, and
I also stopped those for some other reasons.
And dysphoria, and listen, what I'm trying to say, and maybe I was getting some kind of dysphoria even, I can't really understand why, because I have alexithymia, which is also a disability. I cannot process my own emotions. I wasn't being able to understand just how much it was affecting me, and it was very subtle. But once I stopped taking it, God, I felt different.
Because I also stopped, but because of this gender dysphoria at the time. Because for those of you that don't know, actually, I have polycystic ovarian syndrome, which basically is an hormonal imbalance. I have higher levels of so-called masculine hormones, air quotes.
Basically, Rimby here is literally intersex, is what they're trying to tell you on a hormonal level.
Yeah. So it means that I had to take birth control even though I didn't have a sexual life. Since I was very kind of young, to be honest. Like I was 19.
Because transphobia.
Mostly. They were transphobic. They could not accept the existence of. Listen, here's the thing. There was actually a valid reason. Actually, I was taking because to reduce pain and to actually reduce a little bit of my body hair. But over time, I just go like, yeah, body hair is fine, I think. I mean, it's a little thick. I mean, it's a little. If I wanted to shave it, it's going to be a little more painful. This is fine. Why am I even taking it? And then and even the pain was kind of like, I'm not taking for like a year at this point, and I didn't have the very painful episodes that I used to have. So I think I'm fine if I don't taking them, and I just stopped. And I was actually, here's the thing, when I started taking them, I was not even, I was still a hag. You can notice how hag I was, because I was kind of like, this is going to make me more feminine. No, no, no,
Goddamn
I don't want to be more.
egg
No,
so
I don't
hard.
want to be. I don't want to be. No, I don't want to be more feminine. I don't want to start to. I was being stupid. I don't want to get into more than female gender role. I'm going to be more compliant through hormones with the female gender roles. I was like, you think this is dumb, but I was literally thinking that, and I was 19. I was stupid. But no, there's actually some basis on it, because yes, it actually blocks the androgynous hormones, which are basically the masculine hormones. So yeah, there's like some logic that it could actually feminize me, and it does feminize me. It's more gender affirming when your body hair is less thick, because that's what is associated with women. It's a kind of a gender affirming treatment, and I was not liking that at all. Just like I was not liking it. Now I was actually also concerned about my libido, but what's the thing? I don't notice the difference between my libido before I took it and then after I took it.
But that's the thing, the pill can affect you both ways. It can make you more, can make you have more libido or less libido. Although the most common is having less libido, I think.
Less.
But it can also happen the other way around. That's the thing. If you read it, it tells you, well, you can just get randomly horny. Which, yeah, to me, it didn't happen. It actually affected my sex life in that sense, because after starting taking the pill, I had way less libido. Way less. It was actually pretty noticeable.
I'm trying to.
And I'm already in the ace spectrum, so like my libido is a lot of times already not that high. So like, please. I still enjoy it.
It's been a fun experience, because lately I've been a little more than usual. I mean, the usual was 0, literally. So it's kind of like
0. Okay, so like I get like horny like literally one time every 3 months. So that's like a big event.
And 4 days, which is like not even every 3 months. It's just like every once a year, I think. At this point, it's just once a year.
Damn.
Not even kidding. That's funny, because
yes, but try to tell
I think it's
difficult about to cope. Any of that. Just try to talk to any doctor about any of that.
No, they're going to say that I have a pathology. They're going to say like I'm ill or something. Like, that's not normal to have just libido once a year. I was like, hello,
So
I am asexual. I have hormonal imbalance. It is normal. I'm so sorry. I'm just an alternative version of human, don't you see? Oh, you don't, because you didn't study hard enough.
I am pseudo-human.
Here I am. No, I am here to be a case of study after I sign my consent papers. But I'm here to be a case of study, just to enlighten you guys, because you're clearly dumb, because you only study the textbook version of a human being.
It's so interesting, because it's actually a thing that I sometimes find like some random posts online with medical professionals talking about this, like the cool ones, in which they talk about how especially surgeons, I messed up that word so badly, didn't I can't think, whatever, when they talk about how they sometimes, during the surgeries, they open people, and what they find is always, or most of the time, so completely different from the textbook of it, because when you gonna do this kind of procedure on someone, you never know what you're gonna find, and you're gonna find some things that they are not a pathology in any way. They are just things that are very deviated from the norm, which is fine. But I feel like when it comes to actual treatment, a lot of times it's just this very standardized way of acting that has no flexibility whatsoever to individual cases. Rimbi? Rimbi? Oh, Rimbi is gone again. I think Rimbi's computer decided to silence them again. What was I saying? Oh yeah, I was talking about the normative thing. Meanwhile, I'm just going to read chat. Oh, if they're just complaining but don't try to use their complaints as pressure for their partner to go on birth control, then yeah, that's fine. Yes, condoms are annoying. I agree with that. Yeah, basically what I was saying. I guess everybody's body is different, but it seems like such a minor thing when looking at risks at other forms of birth control. Yeah, it is. Speaking on bodies being different, and it's something that
Just want to say that I'm back.
Yes, I noticed. Another thing that you said, Rimbi, that seems all the more relevant now is about how a lot of medication and stuff was tested on white males. And then we don't really have data for other groups of people. That includes people with, disabled bodies, AFABs, people with racialized people, a very specific
Intersex
intersex people.
people.
Another very interesting case that I found, intersex is an absolute myth in what concerns medical.
I don't exist.
No, what I mean is that when it concerns like medical testing, it's mice and men. Anyway, I was trying to say a very interesting thing is how many AFABs report that the ADHD medication doesn't work well on them, and there are several cases of overdosages of ADHD medication because of their periods. So basically what happens is that because of the hormone imbalance of the cycle, a lot of times the ADHD medication is not as efficient as it should be because it was not designed taking in consideration the quote-unquote female body, or the standard for the female body. This does not only apply to women, of course. I'm talking about most AFABs. So yeah, that is also a thing. There is no real scientific knowledge as to why there are hypotheses. It's estimated that high levels of estrogen might mess with levels of serotonin that then affect differently the way the ADHD medication acts, but that's just one hypothesis. There is no real documentation if that's actually what's happening or not.
But it acts on dopamine.
On dopamine, yes. So I said serotonin, didn't I? I meant
yes,
dopamine.
you did. Yes,
but I think it actually messes with both. But I meant dopamine. Sorry. So what I'm saying is that who we are even testing with when it comes to medication, then it's going to affect everyone, because if a medication is always, for example, tested on abled people, how does that affect disabled people with certain kinds of disabilities? For example, and same goes for other categories like gender and race, or sex in this case, or
this is the part. This goes back, like, because it's better to have a standard and then hope that we adapt to that standard. I mean, it's like you live in an accessible society. Like, you live in an accessible society by default, and then if something doesn't work, either you get some form, or like some device to improve that accessibility, or you just don't. It's really that. There's a lot of systemic ableism, a lot of sexism, racism in medicine. Not even to talk about the non-ethical clinical trials in Disabled
Testing?
people in yes, testing. No clinical. There are studies, but it was very unethical in Nazi Germany, for example.
Oh, yeah, yeah,
They
yeah, yeah, yeah.
they did not.
Careful with our
They
words.
did
The
not.
Twitch tends to not like it. Um, but yeah, yeah,
Okay.
yeah. A lot of scientific
Um,
advancements were done there at the expense of disabled people. Definitely.
so because and I had to get the record straight because we have a strong history of a very traumatic history as disabled people that we don't recognize, I think, in hard enough. Which is we have a history of institutionalization. We have a history of being victims of we cannot say that word. The political ideology that German people had in the 40s and 30s, by the way.
The government
There,
specifically.
I did. The state.
Yeah, yeah.
We have, and then again, we were put in madhouses. We were victims of lobotomies. There's a lot of history of just medical abuse, medical invalidation, in that we have to kind of cope with. We did like we are complaining about medical validation right on the current days nowadays, but we can not divorce the past from our present because it's very related to. That's the
It's pretty recent historically speaking, and the scars of that kind of mentality still weigh on us.
same. For example, the lobotomy. I'm going to talk about specifically lobotomy was done in several populations. They were done in gay people. They were done to trans people. They were done to disabled people as well. And as far as we all know, lobotomies have they make the person very, 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 very empathetic. The person kind of loses their personality, they lose their identity. And I know it's considered medical abuse because it was mostly done without the person's consent. It was basically a way of oppressing people with mental illnesses or disabilities, whatever. And I mean, it's not that long ago. Like, there's still cases in the 60s, I think, that were done here in Portugal, I think. It was in Estado Novo, so it's like 40s, 50s, 60s. So we have this very history very present. There is a lot of shit going on during the Estado Novo. Estado Novo is our
It's a
dictatorship
dictatorship, yeah.
period. Yeah. There's like a history of institutionalization. I heard like a while ago that in Brazil, there was a lot of autistic kids that were institutionalized, and actually they were in chains in the walls in order to be
Trigger warning.
sorry,
It's
I
fine.
forgot this one. Yeah, so there's a lot of abuse to us. There's a lot of historical abuse to our disability community that we don't talk hard enough, and it has a lot to do with medical validation. Because you're speaking earlier that we lose a lot of political autonomy. Well, with the procedures that I just mentioned, yes, we
There's
lose.
another thing that I now that you talk about that, I think that kind of weighs on that as well, which is
So go
the
ahead.
role that we give to doctors in the society, because like doctors are seen as one of the highest in the hierarchy in terms of like status, and so you don't question a doctor. The doctor is a doctor. We have this kind of
So totally,
mentality.
yeah.
Yeah, it's a figure of authority. We have this kind of mentality in a lot of things, and I see it a lot of things, and this goes both ways. It's like both the people that go to the doctor going like, oh, whatever the doctor says, because it's like almost a demigod kind of figure, and the doctors actually feeling entitled to treating people like shit because they studied 7 years or whatever to have a goddamn course and had to have like the best grades and had to have their families paying whatever money for them to be where they are. And it's
Not even
pretty.
that. There's like people that go into private schools to study medicine and they just got like doctors like that. Not even just studying hard.
I know, but okay, but when it's public
Yeah, I
colleges,
was just,
you need to
I was just,
have a ridiculous high grade to be a doctor. It's absolutely ridiculous. It's like, why do you need to be so smart? Could you just treat people nicely? What I'm saying is there is so much more, because it's not just that we as disabled people are seen as inferior, is that doctors are treated as the epitome of the desirable thing. It's like, it's the thing of like the kids saying, oh, I want to, be a mechanic, or I want to be a vet. Why not a doctor? Oh, I want to be an engineer. Okay, I guess that's kind of fine, but why not a doctor or a lawyer? It's doctors and lawyers, lawyers and doctors, and their word is final.
there was a time in my life that I wanted to be a doctor. There was a time in my life
Same.
that I wanted to be one.
I wanted
I
to.
wanted to be a neurologist or psychiatrist. That was my specialties at the time.
I wanted to be a doctor because, one, I was an extremely good student, and second, it was always kind of encouraged. It is culturally encouraged that you become a doctor.
Yeah,
it,
it's
it
like
is
you reach the
seen as
high
a
level for social status.
yeah,
Yeah,
it's seen as a goal. It's like, yo, your kid is a doctor. It's like the big thing.
the
It's so,
big job.
and this
Yeah,
plays a
here's the
lot of
thing.
things.
Here's a funny thing, though. This is a funny thing. Sometimes I'm treated as a doctor. Actually, many times. They call me doctor. I was kind of like, man, look at me.
Ah.
I am too young to be one, and I'm kind of stupid. So,
Jesus, Hindi.
and I'm more empathetic, so I cannot be a doctor. Yeah. Sometimes I want to say that, but I can't. But that's because it's so funny. I'm actually very confused, but I'm actually just a technician in training. It's different. What I wanted to say. Hmm. Like I made this joke, but then I forgot what it was. Yeah, medical authorities. I'm very apologist of the process of diagnosis being collaborative, in the sense that it's not just the doctor doing the clinical judgment. Yes, they have to do, but then the patient has to kind of collaborate with that, and what I'm saying is kind of like you should listen more to the patient, and you should be able to understand the factors going on with the patient, because the patient is giving you, if they give you the factors like, oh, actually I work a lot, I have a lot of stress in my family, there's a lot of conflicts, stuff like that. They tell you what is going on with their lives, because the doctor doesn't know the socio-economical factors that are going on. They
Exactly.
can guess, so the patient can actually tell them, and then they have their knowledge and insights and the observation, they do the clear clinical judgment, and then they try to find, okay, they try to make not just a diagnosis, but how we're going to intervene this person, how we're going to make a plan to treat this person, because it's not just me, because it's not going to work if I'm going taking medication to relieve the symptoms. Yes, they're going to be relieved, but if we're talking someone with chronic pain, we had not just to give medication to their symptoms, they're also going to have to be changes in their lifestyle. But it begs the following question. How the doctor does approach systemic problems, because mostly systemic problems, really, like, okay, but listen, doc, I work 12 hours a day. I don't have that much means to stop working because I have to sustain myself.
Oh, I try to tell
And
that to
that's why I have a
doctors. They
lot
don't
of pain.
listen.
That's why I'm saying, like, okay, but the doctor's like, I mean, the doctor no longer has the power in this decision. Like, okay, but how? Like, you want a declaration to make you stop working, but you have to work because otherwise you have no means to survive. So it's reached to the point that it's already systemic. Like the doctor no longer has the power to, treat fully the problem. So the problem is already in the system that makes the person to overwork
Definitely,
and get
definitely.
their problem worse.
But if at least the
So,
doctors could recognize that and at least give you some validation on that, but no, they're
but
gonna
it's
be
some validation.
they're gonna be
But some
absolute
validation.
ducks.
At least this is the thing. If the more doctors recognize actually the context, the system that we live in, we can actually do something to improve a little bit the situation, like the condition.
Definitely.
Like probably you can push the companies to say like, yo, just don't make unions. I think they could actually pressure like the companies to like, yo, you should not make your workers work 12 hours a day. It's stupid. They're getting ill because of that. Because a lot of occupational conditions is because of overwork or bad conditions in the workplace. And the doctor could actually be a big part on that. They could actually tell, like, they could validate what the unions, leaders, whatever you call them, I don't know. And, they could actually be the support to their, demands, I think. So the doctor could actually be a figure in the works rights movement in a way, like, yo, if you have a workplace that has bad conditions, for example, people that work a lot of noise, they get hearing loss really quickly because it's a lot of noise and because the place is not isolated. This is very baseline because there's also autistic people that, they're in workplaces that have also a lot of noise, a lot of stimuli, and they're going to go into burnout. If doctors could actually be more informed of that, of how to make any connection that, okay, it's the problem of companies, not individuals themselves that don't protect their ears, for example. They can actually have influence in actually making this work better working conditions. That could actually be helpful. They can provide that validation. But that is too way ahead of the current system.
It is way ahead because if you do that, then doctors stop having, the final word on everything, and that's not very. Let's
What do you
say.
mean? No, they gave me the validation. They actually get the cake.
What I'm trying to say is that would mean that in the long run they stop being, as recognized as they want, because that would lead towards a society in which the patients get a word, and that's very hard to let go of in a lot of aspects.
Yeah, and I see, because I'm implying that, at least my way of thinking, the patient also gets a word besides the doctor. Okay, because yes, they are the ones that give you the. Yeah. Okay. Yeah, I mean, it's a little. I wish it wasn't that utopia because it's actually very simple to actually do that. If all doctors actually got a little more awareness that they don't have, because they are too privileged. Most of them come from upper middle classes. Of course, they're going to be as aware as, for example, we are from working class. So it is difficult, really. But that's the thing that actually I've been developing over this course of months, because I'm in the medical office, and I'm hearing patients complaining about hearing loss, like they're in a lot of noise. Like, it's because, like, yes, they have the option to actually wear ear protection, but I mean, companies don't actually give them ear protection, or the patients don't use them. But the actual problem is the actual thing. There's a lot of noise that it is like they could isolate the workers from the noise. Like, they could actually put in the room, and it's actually a possibility. For example, if you work in a lab, there's a lot of machines working, they could actually work in a separate room. I don't understand. In factories, I don't know how it works, but I mean, reduce the time that they work there. For example, they just work 4 hours, so you don't get a big exposure to the sound. There's like I was thinking that over this course of months, and I was just like, and the professionals are kind of like, they're not really they're just not aware of this. They just keep giving individual solutions. Just use their protection. I was like, but no, we can actually change the work environment to make less hostile and to make and to not to be I mean, less
Systemic
unhealthy.
problems cannot be solved with individual solutions.
I know. I was thinking like, I'm being too anarchist. I think so. I shouldn't be as anarchist because most healthcare professionals. Listen, it was between us. Not say anything. I trust you to not say this out loud. That though I don't. You didn't hear this from me. They're mostly liberals, and I mean in the sense that they are mostly capitalists.
The liberals are neoliberals by definition are capitalists.
Yeah, neoliberals. Yeah.
Neoliberals are by definition capitalists. I actually didn't understand what you said, so I'm just not. I couldn't audio process it, so I literally did not hear you say it before that. I was gonna say something and then I forgot. What was I gonna say? I was gonna ask you something, Heimbi. Do you think that if you were not autistic and in the context that you live in, do you think that you would have been able to develop the awareness that you have, considering that you were most definitely going to be forced into pursuing a health career regardless? If you were not autistic, and let's imagine that in that case you would be an only child, considering the circumstances, do you think you would be able to get out of that little shell in which most health professionals live in?
If I was an autistic and if I was an only child,
Imagining that you were not autistic, you were an only child, and you were most definitely gonna still pursue a health career because of family pressure, do you think that you would be able to get out of the little world in which most health professionals live in?
It's a tough question. Yes, being autistic in a sense, it made me more aware in how how less accessible, how very little accessibility is the healthcare field is, I will say. But shell of privilege, you're saying that, not being aware of the whole context, like the socioeconomic context.
Yeah, and a lot of other things, because I speak for myself. I was only able to get out of my little bubble of privilege once I realized I wasn't all that privileged at all.
It's kind of hard because I was diagnosed early.
Yeah, it shaped basically who you are from the very beginning.
It's
I'm
hard. It's very hard, actually.
basically what I'm trying to ask you in a way is that if you were in the same circumstances as many other health professionals, wouldn't you have turned out the same? Isn't it really a question of their environment being completely outside the actual reality of what it is like to live as the people that they have in front of them?
I see. Because, oh yeah, definitely, probably. I would turn out the same. Because we are, because I remember, because I had to learn outside from my school this stuff.
Yeah.
I have some bases. No, I lie. I have some bases, like the biomedical, biopsychological. They were based on my first courses of my degree. But outside of that, just pretty much learned outside of that. Like even with my research project, I also got more aware on how not much accessible healthcare system is. Oh, it's not accessible. But it was because I pressured myself to do it. So it was really me learning outside of the school, really. And most of them, because I was in contact with classmates, and they were incredibly they have this mentality. Oh yes, we're going to be kind to patients, but still have this kind of we have a problem. You have a problem, which is hearing loss. You need to get fixed, kind of mentality, and it's kind of hard to when you say imagine if you're not autistic. Well, because my experience were very strict because I was autistic, and the way that it had to be relevant, and it would be relevant to mention how they treated me, because it was already getting in. I will get a sense on how they're going to treat disabled people, because by the way that they treated me. So I have to mention this. And it was very condescending. Yeah. There was one time that I was talking about my bullying experiences, and one of them said, "Why you didn't report it? Those bullying experiences.
Clearly.
You kind of just let it happen." And I just want to cry at that moment because if I did report it, I would go no. I could not explain. I was so afraid that the situation could get worse, and they
You
were
don't
just
even need to go
incredibly
that far.
unaware.
It's an episode still to come about bullying and all of that, but it's no secret that I used to be a bully, and I've gaslit my victims by saying stuff like, "No one is ever gonna believe you. I am the best student of my year, if not of this entire school. Who is ever gonna believe you?" I've said stuff like that. It's so messed up when then these people would get asked, "Why didn't you just report them?" Well, because no one would ever fucking believe me. Simple
Yeah,
as that.
because
Who would
the bully
believe
was
you?
also the best student. Yes, the bully was also a great student,
Exactly.
and
And you were
yeah,
autistic. What if you were just gonna say, you, the clearly autistic kid, was gonna tell the teacher, "Oh, I'm being bullied by the best student of the class." Oh, it probably wasn't that bad. Probably just misinterpreting their intentions. The fuck you were. You were not.
yeah. And there's also a lot of other episodes like that. Like they were just judging me for not making eye contact. They're just judging me for not having a good posture. I was and I got this over time. Like I was into like, oh my goodness, if you're judging me like that because I was seeing as a friend at the time, how are you going to treat disabled people that are not your friends, that are patients? Are you also going to be this condescending? Because I have bad. Because then I'm going to have go in the field of doom. I'm going to lose hope because damn. And I actually have this realization when I was in my junior year, I think, and then a healthcare professional thought that I couldn't do my job because I couldn't interact. So there's a lot of doom with how healthcare professionals perceive me.
Yeah, because there's this idea of how a health professional must look like, must look, healthy to start with, whatever
Yeah.
the fuck that means, must have good communication skills, aka look neurotypical, uh, you know, and basically it's just a bunch of all kinds of isms and phobias, just to even enter the circle, and you're going to be judged from inside and outside if you even try to be a health professional. There's some standards for it that are, I don't know if you guys ever notice this, but at least I do, that every single time I enter any kind of thing related to health, the kind of people that I see are usually white Portuguese, so from my own country, females, usually young, with straight hair, lots of makeup, a lot of them with painted hair, always nails done, that talk in a very specific manner of making sure that every word is very clear, but also they kind of sound a little bit bitchy, not that they mean to, but they
You're
have
scaring
this
my
kind of
classmates.
very condescending kind of speaking, and they are trying
You're
to
scaring
make
my
sure.
classmates at this point. Yeah.
But listen, it's a very formatted way. Every single time I enter one of these environments, I'm like, oh god, I just have the urge to be the most dudish dude I could possibly be,
And then
to
there's
fucking
me.
scare
And
these
then there's
fucking
me.
cishet girls. I cannot possibly deal with this.
The Toad is being a little misogynist here. Stop being so misogynist. The girls can express themselves how they want,
They
Toad.
can express themselves how they want, but they could just, throw their fucking middle class bullshit out the fucking window.
Yeah, and then there's me. There's me like I'm so like, hello, I'm hello, I'm going to do the exam. I'm like I look so like like a nerdy guy basically. And I was going, I'm going to do your exam. This is going to be I don't know how I don't know my script already. Like I just forgot. No,
Mood.
I don't want to be. But like, just imagine, like you enter a medical office, you see a healthcare professional, like a neurotypical one. Actually, not even neurotypical, because my supervisor is very autistic and ADHD, so it's like it's already a lie. They're not neurotypical; they just act like one. It's amazing. Uh, it's a funny story. And then there's like this nerdy guy that very short. Yeah, I'm not very short, but yeah, kind of short, and with tight bun, kind of a very bad posture, very clumsy, and he's going to make the exam. I already have the wrong posture to be a healthcare professional, because I should be straight in all senses of the word.
I should just be straight. Period.
Like straight posture, straight everything, straight hair.
Straight sleeping schedule. Straight hair. Oh my god, the bullshit around hair.
Yeah, because my hair is very wavy. Yeah.
Also, straight
And I used to
nails. How
think
do
all
you
my
not have
classmates.
those long ass nails that they go to every
No, I don't
fucking
have.
two weeks or whatever?
It's like, oh my god, it's horrendous. Actually, you have having those nails is horrendous. It can actually, if you're a nurse, like it can actually puncture,
Exactly.
with that stuff you're
Exactly.
saying.
It's not even practical. Why do health professionals have nails? Why?
But I remember my
As
classmates.
if I
I
would say
remember my
can't.
classmates. I remember my classmates just kind of bitching about. What do you mean you cannot have long nails? It was so funny. I just like bitches. I have short nails. I have just. It's so funny because I have the most adequate air quotes posture to be a health professional, because I know I have short nails. My hair is tied. Um, I mean, my clothing is very simple. My shoes are very, very practical. It's very, very basically sneakers. So I'm very practical. I'm ready to do the work, and it's like,
Yeah.
I mean, but I'm afraid that I might get into some misogynist label, like, because yes, technically you can have long nails if you're a physician. That I don't know. I don't want to get into this discourse. What I'm saying is like, even the physical appearance, you kind of have to fit in one, and I don't fit. Like I'm look too grounded and too kind of clumsy to be one. It's amazing. Yeah.
Listen, I know that a lot of stuff that I said in a lot of contexts would be incredibly misogynist. I am absolutely aware of that, and I know how easily cancelled I can be for a bunch of shit I say anyway. Um, but put it this way, what I am criticizing is not the fact that they are female, that they exude their femininity in a specific way. Individually, each of them is in all the right to do that. What I criticize is that that is the only standard that every girl needs to have in order to even make it in. What I'm criticizing is that the system requires them to manifest femininity in their way, regardless of if they want it or not. It's very standardized, it's what is expected, and it reveals the socioeconomic position of the people that make it in. What I'm criticizing is the system. I'm not criticizing these individuals for whatever personal choices they have on their appearance. That would be very hypocritical of me as a trans person. For a lot of reasons. So that's not what this is about. I am, what is expected it has nothing to do with what is actually needed to perform the job and to perform it well. We are focusing on the wrong shit. That's basically what I'm trying to say.
Oh,
We as a
it's
system are focusing on the wrong
because
shit.
I'm also like that. I know. It's so interesting that you say focus on doing a good job, because I'm also very focused on doing a good job. But most of the times, the criticism that I get is interact better with the patient. I was like,
Why?
Okay, but you better interact with the patient as well. I'm mimicking you. Other thing, you should focus more, or you kind of lose connection when
Okay,
you're doing the exam.
Rimbi, but you
Yeah.
need to understand that interacting with the patient means please do whatever thing you need to do for your exams. I don't know. Please sit over there, and if anything happens, please call me. And you turn your back and never care if the patient is ever going to call you again, as long as you sound nice. That's
What?
what
I
you
don't
mean by
even.
interacting with the patient, probably.
No.
Interacting with the patient is sounding nice, regardless of if you are nice or not.
I
What?
did. Like,
Who cares if you are nice? You need
actually,
to
I tend to interact with.
sound nice.
I know. How stupid me. I should sound nice, and I don't. I just go straight forward with the asking question, like, okay, but you have this thing going on for a while. How when it happens is we're happening since when? Are there other symptoms? Yeah, I'm being very generic, but that's how to get idea what I tend to ask the patients.
Which
If
makes
I
sense,
get
it's what
the
is
liberty to do that.
relevant.
Yeah, but which if the person give me that liberty to do that, because I will do that, because because that's how that's my own protocol.
It's
There's
so
there's a professor.
it's so
There's lots of
hilarious that they talk about um, interacting with the patient when then they neither actually interact with the patient or ask the questions that need to be asked pragmatically to actually solve the situation. I find that so absolutely ironic,
mm,
as a general rule.
like they just they explain the procedures. Like did they say hello? Then they ask some generic questions and then get to explain the procedure and then they do procedure like sort of thing. That's what you're saying.
Yeah.
Um. Yeah, there was ones that actually they don't make that much mouth chat because the patient actually can start. They start talking about their life occurrences. They might say that her mother died. There was one like that a few days ago. And personally, I don't know how I would handle that conversation because it's kind of a hard topic.
Mhm.
And the way that my supervisor dealt with that was kind of like. But it was like very tricky because it was like a hard topic. The patient was crying because my mom died a few days ago before the exam, and but yeah, my therapist actually dealt the best that she could. But yeah, there's definitely a lack of preparation. But at the same time, the patient was like, it's tricky. Sometimes it's very very tricky. I can see that. Other times it's like there's like an incentive to for the profession to like stop the small talking when they can, like just go straight with the procedure. Like they can do some small talking, but please do not do that for the whole session. We have all the patients to attend to make the exams. So there's a lot of that. There's not that much flexibility in appointment length, which I can connect this to the thing that I wanted to say for a while. Flexibility in terms of schedule. Like for example, you can stretch for example, the idea of stretching the appointment so the patient can have more time to process things. This can happen to a autistic patient, for example. They need more time to process information. For example, they're processing the information of the procedure. For example, they need more details, or they need a little more time to prepare themselves because they might be anxious after the whole shenanigan of the hospital, because hospitals can be noisy and all these things. Like it's a sensory hell in hospitals. I recognize that there's a lot
Ugh.
of stimuli that's unimaginable. Yeah, even for me, for example. So they might take a lot of time, some time to actually get a little grounded, take a breath. They might even talk to the physician. Those sort of things need to be done, for example, to autistic patients, and they are not done because this is actually systemic, because there's like a limited time of the schedule forecast, the appointment. But that's the thing that I was researching during the project I was doing, but I didn't insert it because I thought like it, it's still kind of radical to say that you should stretch the time of appointment to actually take the time to get more close to the patient, like that type of thing. thing. I don't know what to explain.
I,
Like,
I, I I don't think that's actually necessary, because it's not really sometimes about getting close to the patient. It's just really make them feel heard. Literally
yeah,
that. It's not that, you know,
when I
it's
mean close, I mean like more
I get what you're saying, Randy.
feel less foreign, I think.
What I'm trying to tell you is that the amount of time that I've lost in appointments because doctors speak over me and I have and say the wrong thing, they try to end my sentences in a way that I'm not going to lead them to. And then I have to literally say, but are you going to let me speak and tell you what you need to know? Or are you just going to try to guess and guess it wrong every single time? I've had to say this to doctors several times. The amount of time you lose with this, instead of, they just stop and listen to 4 fucking sentences before they interrupt you, you know? The difference it would
Because they
make.
think that you know better than you.
They think they do. It's like you are trying to say, so I've started to feel this pain in my shoulder, and it felt kind of like it was kind of muscle pain, right? And I'm like, not exactly. I'm trying to say that, and they start interrupting you every single time. Like, I'm giving a stupid example, of course, that didn't actually happen. But the amount of times they just try to end your fucking sentences on a very, very short sentence. I'm not talking, once again, I'm not talking about how I ramble here all the fucking time nonstop. You would actually save time if they just listened. There's no extra time needed to develop a relationship with the patient, because it's time that they will be not spending on speaking over you and misunderstanding every single time.
Yes, but that's one thing. But I was talking about other autistic patients as well, and there's actually studies about that. You know, that they would be appreciative to have more time to prepare themselves, to get more ground for the procedure, to get more clarification, to get
Oh,
more
yeah, definitely.
reassurance. So that's what I'm saying, and that means stretching the time of appointments. So, and also, and those things are not done basically. But regardless, that the thing that you describe, I'm not trying to remember if that thing happened, and I'm pretty sure that also happened, but I don't know when. But it kind of happened, I think, at least once. But I said I don't go that much to the medical facilities. That's why it's kind of hard to also speak for myself, unless I'm speaking from the perspective of a healthcare professional, which I can. But from a patient, sometimes it's very difficult because, well, I have strong medical trauma that makes me avoid health facilities, period. Because I also don't have that much medical conditions as Toad has. So, and the ones that I have was basically either my mom's pressure that I went there, or just like the house is burning down situation, which was kind of rare, but it did happen. Like, for example, like last time that they are far away. I can say shit about them.
No, I was just getting my charger because my phone is at literally 1%. And I was answering chat on the phone.
You're told. Okay, just kidding. There was actually I went to a visit because I had an ear infection in the summer. It was a fun time actually. So I got
Time.
it very wasn't. That's besides the point. So I go to the doctor, this very pleasant doctor, and they went there and they were so nice to me. I just remember being a little dry in their approach, but okay, that's fine. But then I just remember that they just deliver like the prescription paper, they just throw it at me. Kind of thrown, you know. And I was kind of like, nice. It's not even aggressive. I don't even feel scared. And actually, I knew the dipshit. Actually, I knew that he was actually kind of a bad doctor. So it was like, so it's kind of like, okay, frightening, because I just did an intervention in my ear, like I was cleaning my ear from the wax that was building up and making the infection. That was not pleasant. Yeah. And I just felt better afterwards, just knowing that he was a bad doctor by the name of that was present in his prescription that he'd thrown at me.
Damn. Speaking of situations like that, I just remembered, and this one didn't happen with me, it happened with someone else. But basically, there was a situation in which a person went to the hospital on emergency, and basically they were diagnosed with the wrong condition at the time. It was an emergency kind of deal. And basically they were sent home with a lot of meds, and then they had to go back to the hospital literally like before dawn. And suddenly, when there were actual very bad visible symptoms, they went for a different diagnosis, because they went with the most obvious thing is they just sent home, even though, you know, there was actually several days of things not getting better and extreme high fevers. And it partially happened because the person in question, because of the pain they were feeling and the fever and being ADHD and autistic, they went semi-verbal during the whole process. So because doctors were being either very pushy when trying to speak and not letting the person actually, you know, say what they had to say, and a lot of the other time they were just left alone for hours and hours and hours waiting for someone, and they couldn't even reach out to a nurse because they were semi-verbal and they were in a lot of pain. They couldn't really move much and they couldn't really call attention. They were just either left alone in the silence without any clue of what was going on, or just being dismissed and just shoved around as an object. And all the exams that then were done when the actual diagnosis came out were incredibly intrusive and done in very rude ways, no anesthesia, just saying, oh, it's not really gonna hurt. Spoiler alert, it very much fucking did, because the last time I checked, colonoscopies kind of hurt.
They do hurt a lot, actually.
Yeah. And let's just say that the person had literal fucking ulcers, and that fucking hurts, you know. Due to circumstances, it makes the procedure even more hurtful than what it was already gonna be regardless. So basically what I'm saying is, if it was a quote unquote, if it was a neurotypical person, let's say, this whole deal would have been bad as it was. But this person was taken away from a simple tool, which was the ability to fully speak. And suddenly, this is what happens. The person is sent home with the wrong diagnosis, having to go back because they are literally fucking bleeding from their butt to the hospital to actually get a fucking decent diagnosis, and they are left for hours waiting and just doing intrusive exams after intrusive exams without any kind of explanation of what's going to happen, and just saying it's not going to hurt, because they're not being taken seriously, because they look fragile, they look lost, they are infantilized. This is how disabled people are treated on a daily basis by health professionals. When something actually serious happens and these people lose the ability to speak up, you either find good professionals and you pray, or you can't do anything about it. You are left without tools.
I'm just beloved by the colonoscopy, by the exam without the anesthesia, because like there are solutions to this. Because here's the thing.
My dear, there were also solutions to the fucking thing that they did to my butt that last time.
Here's the thing. What if, this is a wild idea, I know, this is Toad, Just Cat, Sorry, how her name is pronounced? I'm so sorry.
Tetsin is not here anymore. She had to go not too long ago.
Okay, sorry. So it's just got here. Okay, this is a wild idea. What if healthcare professionals were more autistic? I know this is wild. I know. What if they were neurodivergent? What if they were disabled instead of being neurotypical? The minority would be neurotypical. But what if they were all autistic, all ADHD? I mean, ADHD would be kind of tough time, but
it would be at least hilarious. It would be way sexier.
No, that's a great anatomy, but with all neurodivergent daughters. No, seriously though. Actually, I'm doing this just shit post, but and kind of like makes this puxar a asa à minha sardinha, but
meaning making the argument a little bit more appealing to their side. It's a Portuguese expression. How do you even say that? I couldn't even translate that. Wow.
It's a very specific one.
I know.
They are surging. Okay, while they are surging, because we have high levels of hyper empathy, which is, I don't know, it's kind of like useful for patient approach. I don't know. I'm guessing. I don't know anything. And we also have a very direct communication skills. And we also have a very rigid way of thinking, which is very useful when we are approaching patients, hyper empathy, when we are explaining procedures, direct communication skills, and also rigid thinking when it comes like we had to follow this protocol that we created that is very efficient to treat patients a little better. Like doing that, we had to do the procedure, but at the same time, we also had to prepare the patient for that procedure. Whatever that means, it means like doing some emotional work if it's necessary, for if the patient is too anxious, if the patient is too depressed, whatever, fearful, whatever. We had to do the emotional labor. And we also had to prepare like physically, like just setting up the thing, whatever devices we had to do, like electrodes, whatever. So we have at least these three characteristics that could actually be useful to improve at least the healthcare services, at least locally. I'm not saying systematically, but at least locally. Why is it a wild idea? Why?
Ableism.
Because it's the thing, I just get more bewildered by this.
Listen, we do need people with different ways of communicating in the health facilities, because like it's good to have a protocol, and of course you still need to follow a specific protocol in serious situations like this.
But it's not even full, because they did the procedure with anesthesia. They didn't even follow the freaking protocol. That means just doing the procedure with anesthesia.
No, because it was an emergency. It can be done without anesthesia in cases of emergency. It can be done without anesthesia. It can. Listen. What? Yeah, it can. Listen, for example, the procedure that I had done to me, I'm trying to be as little descriptive as I can be. But basically I had a cyst that was infected, and it was there was a needle put to it, and then it was basically pressed so that everything that was in would come out, the infection, the infected liquid, whatever thing. And you know, when someone puts a large needle in a thing that already hurts, it wasn't nice. There were alternatives to this. They could have given me a general anesthesia, you know, on the spot, and do this procedure while I was asleep. This was a possibility. And yet what was done to me was that they put a little local one of those is just a spray that they put on you, and it gives you a cold. It gives you a cold sensation on the skin. I'm telling you, on the skin.
Epiderm, derm, whatever goes.
That's it. Inside, I felt everything as if I had nothing. At least the doctor told me this much. I was like, it's not going to do much. It's basically going to give you a little bit of cold sensation, but hopefully it helps. It's going to hurt a little bit. This is what they told me.
A little bit.
They could have put me to sleep, but they didn't. And they did this on the spot, like this. And I shouted
You
so
had to save money. We are at
much.
war. We had to save money.
I shouted so much. I don't think you understand. I started crying and begging, please stop. I can't take anymore. I was so absolutely taken aback by everything that was happening. I wasn't even speaking in Portuguese, so that you have an idea. I couldn't even speak in Portuguese. I was literally crying out in English, please stop, I can't take this anymore, just please make this stop, please make this stop, please make this stop. I got out of that hospital still fucking crying. Oh, but the best part of this, guys, I just listen. They did that to me. It was on my butt, right? The doctor tells me that I can't stand up. And they went to get like a letter for me to give to my nurse so that I could do change the, I forgot how you say, the bandages kind of deal at the nurse. And the doctor turns to me and says...
The Band-Aid.
Yeah. The doctor turns to me and says, you can sit down. I can what? I was seeing everything rotating. I could barely stand up with how much pain I had in my body overall. But well, he had no way of knowing that I suffer from that literally every day of my life. But after what they did to my butt, the doctor tells me, you can sit down. And I was speechless. I could not say a fucking word, and I just did not move. And then the nurse that comes to me and says, but you can't sit down. And I'm like, no, I can't. And he was like, oh, yeah, okay, maybe you can sit down. Does it hurt? And I'm like, able to fucking slap the dude right there. Just, this can't be fucking happening. This can't be real. What person in their fucking mind would tell me to sit down after what they've done? I left that place and I was still fucking crying my eyes out. So yes, there is a lot of things that could be done. And I tell you, for as much as a colonoscopy hurts in those circumstances, I think I can attest that I went through more pain and I received a fucking skin anesthesia.
That does nothing, though. I don't know that.
Yeah, it was basically the same as nothing.
Yeah.
With the levels of pain that I was feeling, a little bit more or a little bit less, maybe I would have fainted if I didn't have that, I guess. That was also a possibility. Maybe I would have fainted and maybe it did something, but I didn't feel like I could feel any more pain than what I felt in that moment. I don't think it was physically possible. And if it is, I've never felt it in my life. And I don't think I want to find out. I'm not that curious. It's messed the fuck up.
I'm just afraid of giving both cases, yours and that person. I might say that I'm a little bit lucky on that because one, I've been
or maybe
avoiding
we are
most
just
of us.
unlucky really. I'm extremely unlucky with the health professionals I get. Like, I'm just gonna say here, when I talk about my experiences to most people, they just say, you are so unlucky, or maybe people are just ableist and I actually look a little bit disabled.
No, listen, I have most of my share of ableist experience as well, but it's mostly not physical procedures. It's really like just being condescending, not really just being discrediting me or invalidating me or just asking very odd, unrelevant questions. That happened several times. Not just the sexual orientation one, just like if I was, listen, one physician asked my mom if I was able to use public transportation because I was autistic. And I did have, here's the thing, it's kind of hurtful because I did have to know how to use public transportation. Otherwise, I would not go to college. Otherwise, I would not go to hospitals. So it's kind of a cruel question, actually, because I know how to use the ability transportation because I was coerced to do so. Otherwise, I don't get anywhere in my life. So there's like, it's the lack of awareness that is, at least for me, it's the most wilder thing ever. Because they just ask me if I know to drive, if I know how to do this and this and that, and they don't realize that I had to. Because here's the thing, there's autistics that had to do stuff, I think. Like neurotypicals, though, in order to not be as a disadvantage as they can be. I think when and there's like a share my share. Listen, if you're sharing a painful experience, I'm going to share mine.
Go ahead.
When I was a kid, like this, there's this family doctor that you know, and she was very condescending, and she asked me to read a thing in front of me, and I went nonverbal there because my mom was near to me, and my mom knew that I would go nonverbal when I was next to her. So it was kind of a selective mutism thing that I still don't understand why it happens. But then, if my mom was not smart and realized that I could not read in front of her, my very intelligent and very caring physician could actually think that I would have a learning disability if I was not able to read. So my mom went out of the room because, like, okay, I had to yeet out of this because you're not going to read, girl. And then when she went out of the room, I read the text perfectly because I'm epileptic.
Yep. It's really about the fucking context, but no.
No, but I'm told this was mid 2000s, the knowledge of autistic was amazing at the time. I mean, it still is, but it was even more amazing at the time. There's like a lot of scary things that happen. I just don't remember because I already repressed them, but my mom still remembers them, and it's just awful, I think.
You
Most
also were
recent one is
young, so a lot of them might not be repressed as much as they are, you were a child, for as traumatic as they might have been or not.
I mean, they're very present because now I'm avoiding healthcare facilities, really. So they're very present, but I just am not really answer them.
Gotcha. No,
It's
that
like,
makes sense.
so, listen, I don't go as much to my family doctor, and I should do because I have blood analysis. I don't do blood analysis tests since like 2 years ago. So here's that. And that can actually put me to medical negligence because I have this very present trauma because I'm being avoided all the time,
Which is a thing that happens a lot in disabled communities. It's that we just overall, because medical trauma, avoid going to doctors, and we get a lot of negligence as a community because of that. You mentioned that, I think, in the beginning of the podcast, didn't you?
Yeah, in the middle, I think. But yes, I did mention. And there's like studies that actually prove that medical trauma actually enhances medical negligence by the patient because they are just so afraid of reviving that shit again. And the conditions is very vicious circle because then they might have a condition that they need to get that checked out, and if they would check out earlier they could actually get some treatment. But imagine if it was actually a very serious condition, now they get to check out later because the symptoms were becoming too much to handle by their own, and then they can get a worse prognosis. It's just maddening, and I'm afraid that might happen because I also have a lot of dysfunction that makes me a little bit struggle to actually do medical appointments, because I take a long time. Because I was also pressured to neglect my needs. So here's that. Like I always say that everything is fine. Like even
Welcome
though
to being an AFAB.
But I have knee pain for 7 years. So, but that's fine. It doesn't occur all the time. Like it's not even real pain. It's just like a weird sensation that I have in my knee. That sometimes I felt that even the joint is like it cracks, kind of like.
You're sounding like me. I mean, this is not really all that serious. I mean, I just kind of feel always kind of tired and I sleep a lot, but I guess all people have different sleeping things. I mean, right? And like, it's not like I'm also for my pain. It's not like it's always pain all the time. A lot of times it's just like mildly inconvenient. It's kind of like discomfort. It's not really pain. So like, this is kind of fine. I mean, there are people who are dealing with actual pain every day, right?
Yeah.
And
And you
for
are
a
the
long
one dealing with actual pain.
and that's the thing, for a long time that's how I was treating it, until I fucking stopped being able to walk, and I'm like, oh wait, I literally can't fucking walk. Yeah, this kind of
And
hurts.
this week I was
Fuck.
Yeah, actually, because of that, because listen, because I research a lot, so it's kind of like it's kind of helpful when you avoid healthcare facilities, but you still like you're curious about what condition you might have, and then you also happen to be like you have a background in health science, so it's kind of like, okay, but at least I can know if I'm going to avoid the doctor. At least I'm smart and I'm going to research all about the condition and make sure if I should go to the doctor or not. That happened, actually. I did that. Actually, no. And we do have fatigue thing, because I've been dealing with fatigue for at least 2 years. And I just realized like a few weeks ago.
What a mood.
That is like, this is, and actually I didn't realize why. It was because of my ADHD. Probably it is, but I will not deny it's also anxiety and probably
Depression makes you feel tired all the fucking time. So there's definitely probably a factor. I'm very good at this. A factor of it to that. Not saying it's caused by that, and not trying to play the depression card. It's like, oh, you're just depressed, but no, just saying that maybe your psychological state might have a little bit of a role there.
Just 1 second, I'm going to close my door for a bit.
Yeah, that's fine. I do need to ask you something in what concerns that, in the sense of specifically ADHD medication. I'm actually quite curious on if it affects your mood, specifically in what concerns your depressive moods. And hopefully they'll be back before 1 a.m. Rimbi? They said they were going to close the door. They didn't say they were going to be forever gone. Rimbi. Mid is out. I don't know what. Rimbi sends me code messages. I'm here and mid is out. What do you mean mid? What do you mean? What do you mean? Oh, did you mean that your setup just went absolutely bazonks? Oh, yes, Mike. Technical problems again. Guys, support these peeps. And by guys, I mean Jess Cat, and by which I mean please don't.
Okay, I'm back. And the microphone.
Anyway, did you hear my question? Rimbi? Are you okay?
I am. I think so. I'm back again. This thing I was speaking, and then it went out again.
Mm-hmm.
Yes, I do speak in code, but because I was like, I had to say something very fast, and I was trying to set up again.
It's because I didn't understand the mid.
Because I know why it happens. Because it's the cable. It's the cable. Yeah. The cable is very. Yeah.
Did you hear my question?
Yes, if the ADHD affects my depression moods, ADHD medication. I think I don't know if because actually taking ADHD medication made me question if I really have a depression. I still Because I remember when I said to you that I probably had depression, it was mostly fatigued. And yes, there was
Mm-hmm.
sadness because I was feeling like a lot of procrastination guilt. So it was like, but still,
Ah,
but
beautiful. The AFAB experience of having ADHD. Maybe you're not anxious and depressed and you are just going on those loops because of fucking ADHD.
yeah, that's why I was kind of like, because I had this realization because I was like taking medication. I was kind of like, okay, I don't feel as less fatigue until I can move, I can get out of bed, I I can do things, and but I will not even still discard depression because yes, there were moments that I just feel an enormous sense of doom that. But I don't know if it's actually depression. I don't know. It's at this point, I don't know. Um, But with ADHD medication, it actually kind of reduces it in the sense that since because I was perceiving my fatigue as a symptom of depression, uh, but there's the thing, something happened to make me more fatigued by on that month. But I don't know, like I remember there was a lot of stress on the month before. I remember there was a lot of stress, and I just went like nope, and I could not move. I was dragging myself. And when I use medication, I think it doesn't. It makes me less fatigued. I mean, I still feel sleepy, but
Mm-hmm.
regardless, that's like. But at least I don't because if I stay still on the like I cannot if I cannot move as well, I can get depressed because well I'm feeling guilty because I'm not doing anything and I'm seeing the day passing by and I'm not doing anything and I'm just being a lazy piece of shit and I'm not doing anything. And so this circle
Jeez.
of thinking was getting like it just put me in a very bad place that I don't want to come back. So the HD kind of prevents me to get too still, I guess. Even though the nightmare that is my thought patterns, it's still there, you know. But at least I can do something about it. Like this, if I'm doing things, they don't occur that much. So yeah, it's a nuance. It's very nuanced. But then again, if I wasn't diagnosed with ADHD, probably I would be diagnosed with depression if I was lucky. Yeah, because I have also a natural sense of doom. Like I always kind of like chronic feels of doom that can be easily be converted into anger. So there's actually a lot of like, but that's another episode actually. So I'm not gonna touch it here. Uh, but yeah, it's pretty much it. Like, and because if I didn't have the knowledge that I had ADHD, probably I would describe symptoms to get a misdiagnosis. Really, probably.
Mm-hmm.
Or just not get diagnosed with ADHD, which is the root cause of this. So yeah, I hope that answers your question, which is kind of like long.
Yeah, I guess then in that sense, uh, maybe then I guess what made you realize that you were actually fatigued was like, wait, maybe I didn't really have depression. This was ADHD, but I'm still tired. Then if I'm still tired, something is wrong outside my supposed depression, right? Did I read that right? Did I understand what you were trying to say right?
I mean, that's what I said. I mean,
Okay, I was trying to see if I read it correctly because it went off on a kind of a tangent and I was summarizing it and see if I actually got it. Yes, okay.
yes, basically, yes, it's that. Like, I was too fatigued, but I still did with depression, but now it's actually caused by ADHD, but then there was a lot of stress. But it made me think that there were also factors that could actually make more fatigue. So it made me think, like, okay, I can
Well,
try to see
I
what
can
factors
tell
are, and I
you,
tried, yeah.
yeah, I can tell you that as you try to approach a doctor on this matter, you might receive some comments like, those are very generic complaints. Oh, I don't know what could be causing that. Have you been sleeping well? Do you have sleep disturbances? Are you sure that you actually sleep well? Are you sure that you've been sleeping the right amount of
I don't
hours? But
know.
are you sure?
I go
Uh,
to
and I'm just
I go to
like,
sleep at 2 a.m. and I wake up at 7. I mean, probably.
Yes,
For 5 hours.
you don't help yourself with the amount of hours that you sleep, and then you want to not be tired. There's kind of that, maybe, really. You probably should actually try to fucking sleep. Sane.
But I want to do things, so it's not like, no, I don't want to go to sleep at 11 p.m.
Well, but then you complain that you're tired. I'ma slap you, bro.
But I'm always tired, so it's kind of like, I should just go to 2 a.m. like, and I do some fun shit before I go to the hell site tomorrow. So
Okay, no seriousness. If you actually sleep, let's say for an entire week, if you ever did this experiment, if you sleep a regular amount of hours with a good sleep schedule, do you still feel fatigue?
a whole week sleeping 8 hours.
Yeah? Or 6 to 8 hours. Okay.
I do. I think I do a little bit, yeah.
But do you feel better?
I don't know, probably.
Then wouldn't it be worth a shot to try that out?
Because I can't, I'm too used to this schedule. Like I'm going to, because it takes a while to adapt to do that.
Yeah, of course, it's a
shit.
new routine.
Because it's a hell site of a schedule, to be honest. Like sleeping 8 hours. What are you doing with your life? To only sleep
Bro,
8
I've been
hours.
sleeping 10 when I'm lucky.
Okay, that's you. But for me it will be like
How do
sleeping
you think
8
I feel
hours.
about this? Do you think I feel good about this? I hate that. I feel like I'm missing my entire life.
Yeah, see. That's why I sleep so late, so little.
Yes, but I mean, you can still complain that you're tired, but you're not helping yourself there, dude. Because put it this way, do you want to, because in my case, what makes me angry is not that I sleep 10 hours, is that I sleep 10 hours and I still have shit quality of life in what concerns my fatigue. But do you prefer to live your entire life more, but always sleep deprived and not actually being able to do things, or give a shot of, actually the amount of hours that you are awake, actually being awake and feeling okay, even if it means that you need to sacrifice a couple hours, but that you actually have quality of time over quantity?
But it's my routine. Like I've been sleeping like this for years. I cannot change that over like.
Of course you can.
For a week.
But you could, I guess, still try to give it a try on the long run. I don't know.
Not even 7 hours, because sometimes I do sleep 7 hours.
Okay,
Listen,
try to do it 6. It's already better than what you're doing, probably.
That's my average, actually 6 hours. Listen,
okay, 6 minimum then.
But that's my look. Listen, there was like yes, because I can sleep 8 hours. It depends. There was like days I slept 9 and I still feel tired.
That makes sense, yeah.
But that's because, my sleep schedule is a little erratic. So it's like one day I sleep 9 and then the next day I probably sleep 5. That's not helpful, I will add. But it's like, but listen,
did your thing die? The mic silenced you. You were saying so much bullshit. The mic went like, nah, bro, nope, haha, bye-bye. Oh, dear. Yeah, I'm just saying, because, like, of course, it shouldn't be dismissed just because you are not sleeping, quote unquote, enough, that your fatigue is because of that. But I don't know, it also feels kind of like you probably, if you can, should try to sleep a little bit more and see if that at least helps. Because if it helps, then maybe that's what you've been missing out. Because probably what the first thing that is going to happen is that you're going to be sent to a sleep kind of professional and evaluate if you're sleeping well and if you're having like good sleep cycles and whatever. I know that you're there, yes.
Boy, think I'm here? No.
Yes, you are. I already confirmed that you are here.
This cable, I cannot move a fucking muscle. This cable is already
Yeah.
dying. So, okay, addressing what you're saying. Since I got interrupted by the mic, I got interrupted by tools, I got interrupted by everything.
The universe itself.
They cannot handle this amount of bullshit, really. They're like, shut up, Remy, you could just sleep better.
I'm not saying better, but maybe try to sleep a little bit more.
I don't know. It's because this thing. It's also very socially motivated. I would add, because that's the time that I got my more peaceful. To be honest, it's not like
Oh, yeah, I feel you so bad on that one.
because people just hear scream. So like that. So there's a lot of factors, and also because I'm very used to this type of schedule. So it's kind of like, imagine just say like, why don't I go to bed at 11 p.m.? What, to wake up at what, 6 a.m., 5 a.m.? Because that's usually how I think. Like, imagine just go to sleep at 11 p.m. to then wake up at 9 a.m. That's like 10 hours of sleep. That sounds a little criminal to me, but I don't usually sleep this amount of hours, and I just get a little bewildered by it. Don't get me wrong, there were times that actually I slept 10 hours and I just got tired.
You need sleep. Speaking of sleep, should we
And to sleep.
Yeah,
Yeah.
I need to work tomorrow morning. And I'm gonna have a hell of a day because I start working at 10:30, and I do have a big break in the middle of the day, which sometimes doesn't help because it kind of cuts the flow. And then
Oh,
I'm gonna
same.
only gonna finish at 9:15, and then I still need to go home. So like, yeah, I should probably get some rest while I can, especially because those hours that I supposedly have to rest, I'll be doing arrangements of bad Christian songs for Saturday's wedding. I am crying.
Either
The
for
things that
that,
musicians need to do.
is for that. Oh my goodness. And probably I'm going to do. I don't know what I'm going to do tomorrow.
Rimbi, do you have any suggestion of theme for next week? Maybe the one that we were supposed to do one for this episode, and then we didn't because we wanted to do this one, but we kind of had
Yeah.
decided on a theme. Do you remember what it was?
Executive dysfunction.
Oh, it was executive dysfunction. Do you want to do executive dysfunction next week?
Yeah, because it was delayed, I think, by my fault.
Yeah, that's fine. Then next week will probably be executive dysfunction, unless executive dysfunction hits hard and we can't, or unless ADHD hits hard and we space out of that topic and do something else. Stay tuned to find out.
Yeah, probably. There's going to be shenanigans there, you know.
Shenanigans will happen and will keep happening.
I mean, shenanigans happened on this episode. I can't remember which shenanigans they happened. I mean, unless I swear to God, this is going to be the last time that I use this fucking microphone. I swear to God. This
No,
is
you're
it.
gonna get a
This
better
is
cable. That's it.
no, no,
Yes.
no.
No problem, Jessica. Thank you for being here.
Thank you, mate.
Yeah.
Is it? What else is there? Is like evening there? I don't know. I know it's Australia.
Jazz Cat does not have a schedule. Jazz Cat lives on non-time zone.
Yeah,
It's
he lives
ridiculously.
backwards.
It's like whatever. It's. I mean, it's more crazy than that, because like when we start streaming, it's like something a.m. there. It's crazy. I don't know how Jazz Cat is here. Y'all are awesome.
I don't know.
Jazz Cat says. My voice is sounding
Hey,
extremely sleepy, isn't it?
kind of constipated, but that's pretty much the case.
Guys,
Constipated. Yeah, I should go.
it's
Also,
not
you walk
constipated.
backwards.
You meant. I don't know what you meant, but that's not what that word means.
I know. I was being post-ironic.
You are up, Jessica.
Oh, thank you for your support. Actually, it does mean a lot. Just being here as a loyal listener to our podcast, it means a lot. I say
Definitely.
this
We
general.
have like one person that listens to this podcast, and that person is Jazz Cat. Sometimes we have one or two more people that drop by and then they leave and then they come to say hello and then they stay for a while. But we have Jazz Cat. It's like the man that stays here all the fucking time.
I mean, I don't know how you have the patience to list me for hours, but that's
Kind of same. I mean, I don't know how people deal with me at my own stream when I'm speaking so much, when I'm not literally fucking playing the violin. Because, like, I can understand that people like to listen to the violin, but the bullshit I say.
I mean, I'm there for the drama, really. I don't care about violence. I'm just there for the drama, really. Just for the
Speaking
shit
of
post.
drama, I played your fucking Jeremias. So if you want to check, I don't know where it is on the
Yeah.
pod, but good luck. It's in the
Yeah,
second
I'll
half.
find it. Thank you very much. Jeremy, I don't know that's the thing. I never know the lyrics. I just do the melody.
From second,
Eh.
I'm sorry. I'm gonna start singing it on the lower octave. So instead of going, I'm gonna start going. Vou falar-vos de um curioso personagem Jeremias, o fora da lei. Descendente por linhas travessas, engendrados, telhado. I'm gonna start singing it like that for you, just for the fucking meme. No, I'm not. I should be sleeping. Why are we talking about music shenanigans?
Because you are music shenanigan. There.
Oh yeah, that was my fault. Fuck. Anyway.
Just go to sleep, but I'm going to sleep.
Yes.
Probably I'm going to sleep. You go. Bye.